Welcome everyone. Today is the 5th day of the 5th World Traditional Chinese Medicine and Acupuncture Week. I am the host Tao Xu. Now let's start today's English online lecture. So first, we welcome speaker Dr. Hui Ouyang. Let me briefly introduce. Dr. Hui Ouyang grew up in a doctor family of TCM. He currently practices acupuncture and oriental medicine and chiropractic manipulation in southern Houston. His topic for today is acuchiroptherapy for spinal and related disorders. So, Dr. Ouyang, please start.
Thank you. Thank you, Dr. Xu. Yeah, and you can help me, right? Yeah. My presentation here is about the acuchiroptherapy for the spinal and related disorders. Here, I was educated and practiced both China and the United States for a dozen years. I have established a unique acuchiroptherapy in order to safely and efficiently diagnose and treat the disorder of the spine and even the whole body. And here, the objective for this therapy is integrate the Chinese and the Western medicine with both modern biomedical medicine knowledge and the traditional meridian theory, especially meridian theory, and especially the source of accurate diagnosis and holistic approaches, and develop the efficient practice methodology that prioritize the safety. So safety first, then we can do efficient. And what should we do detail here is we have the up-to-date the spinal health knowledge for prevent or prognosis for the spinal disorder problem, and with dynamic spinal examination and precise muscle testing for accurate diagnosis. As far as the holistic approach, we combine meridian differentiation as well as stretch exercise, all this holistic approach to our practice, and optimize the acupuncture, chiropractic technique with all this physical therapy and exercise in order to safe and efficient to have our practice. And we use a personalized differentiation for the rare cases. So where clinician basically is efficient and useful in our clinical practice. So acuchiroptherapy is a unique clinical method that integrates Chinese and Western medicine for examination, evaluation, diagnosis, treatment, prevention, and prognosis for the spinal related disorders. And here we use theory integration, many symptomatically and comprehensive for as far as the theory, and at technical part, clinically we optimize all this technique, try to be safe and efficient. Here, the personalized differentiation, including the syndrome differentiation from the Chinese medicine and the disease differentiation from the Western medicine. So differentiation and including syndrome and disease differentiation, will try to combine them together for a more efficient diagnosis treatment. And here we, according to the part of a human body, the spine is roughly divided in two parts, right? Cervical and lumbar spine. And cervical spine, they support the movement of the head and they extend to the upper extremity, and the lumbar spine, they support the movement of the trunk and extend to the lower extremity according to the functional characteristic of the spine. The spine is further divided in several functional units like spinal segment. The functional characteristic of each segment of the spine are used to explain the diagnosis and examination method in each segment. For example, cervical spine can further divide into occipital cervical segment and cervical scapular segment. And lumbar spine can further goes to the thoracic lumbar segment and lumbar sacrum segment. Here we are, the acute cryotherapy, including the acute cryo examination, diagnosis, and treatment. We can see examination, including the posture, range of motion, palpation, also neural exam and muscle testing, which is our special exam for more accurate diagnosis. And as far as the treatment, we can see acupuncture, manipulation, movement, stretch, all this, we put them together and optimize for individual case. In between, we use the diagnose, go to the each spinal segment for more precise, accurate diagnosis. At the same time, we use the meridian theory and the spinal nerve theory to relate the whole body together. So synchronize the examination and treatment, integrate the diagnosis and the treatment, be safe again and efficient. Here we are, the acute examination, including the posture, range of motion, palpation, also neural exam and muscle testing. You can see here range of motion, flexion, extension, lateral, right flexion, and rotation. Here the palpation focus on the like arch point, and we use the updated information from the trigger point to precise our arch point. And here the neural also neural exam. That's a very basic knowledge from the Western medicine. And I have more unique muscle testing, which is including muscle length and strength test for more precise diagnosis. And here for cervical spine, and you see the posture, including upper cross syndrome and C-spine, range of motion, flexion, extension, and rotation, and palpation for the trigger point, or also neurotherapy, mainly the traction of the brachial process, and the neurological exam mainly focus on cervical 6, 7, and 8. Then special muscle testing here is the levator upper traps. Here, for the lumbar exam, mainly similar but different from the cervical exam, is posture like a lower cross syndrome, and palpation and muscle testing basically focus on the trunk muscle, and like iliopsoas, quadratus lumbaris, psoas, and multifidus. Here, what we do here, combine all these technique, not just simply put them together, but optimize them, try to include try to make it more safe and efficient. Here, that's an example for the technique optimization. For example, acupuncture therapy for the cervical scapular disorders. And because shoulder area, neck and shoulder area is most common, the acupuncture accident happened. So in this case, we can use some grasp, like a shoulder wear technique. It's strong and very, very excited the therapy. So it's equally have effect with acupuncture, but we can avoid any risk for puncture through the lung, cause the neurothoracic. And another example is we use acupuncture therapy for occipital cervical disorder, because suboccipital, when we do manipulation, they cause very easy cause the risk for like a vertebrae artery dissection. So in that case, if you have no good underneath anatomy, use acupuncture, we needling just outside your scalp, we can reach the same result as manipulation. So that's why we have some all these techniques, and we can optimize different techniques and put them together for certain individual disorders. Yeah, have a maximal result. Here is acupuncture technique. Basically, we use acupuncture 3 needle, including local, proximal, and distant acupuncture point. And here we use a lot of the trigger point and local point and distal point, and proximal and distal point, we basically use meridian differentiation, which relate to whole body. And we all know usher point, the trigger point is 通则不痛, 不通则痛, 通则不痛. So yeah. And here's a meridian and acupuncture point related. And acupuncture for treat all these neuro, spinal, and related disorders. These disorders basically because of aging and trauma, right? And acupuncture was able to activate the blood circulation and unblock the channels and tonify kidney and strengthen the bone and tendon. Here's the more detail for the cervical degenerative disorder. And upon your point, here's a point for the lumbar degenerative disorders. And as far as the acute manipulation, including the manipulation, acupressure, tuina, all these we can all use. And this is manipulations. And for example, for the low back pain is very costly. And acute therapy, we use that for low back pain. We can achieve a very safe and efficient result. Here is one of example. The patient is the long distance runner, female, 165 and centimeter, and it's almost 50 kilogram. It's a very athletic build, and she got acute and recurrent low back pain left lumbar area. What we see her, he has a very constant sharp low back pain, and relief with nothing but aggregate when he stand from the sitting and other position, especially he cannot straight up. And as far as the X-ray issue, nothing like a fracture or any malignant problem, but basically it's a normal X-ray. Actually, but when we see here from the spine X-ray, we can see if we tilt, it's a significant curve, actually S shape, lumbar curve to left, and the thoracic go to right. And with that's the most we can have from the X-ray. But to the examination, we got a lot of information, not just range of motion, but also we can see S shape of the spine. We go more detail. We found more precisely in the left erect spine and some spinal muscle, especially the multifidus muscle. We have the typical the muscle spasm over there. And furtherly, we check the range of motion. Basically, patient have pain from every direction, especially flexion extension. Then through the muscle testing, we found out erect spine is positive. And the erect spine muscle testing is positive. Multifidus muscle is also positive. So with this diagnosis, we have directly treatment options, because that is including its spine on the back. The pain area is on the left side around the spine, and the lumbar sacrum area. So that is related to the dual and uribladder meridians. So the treatment option basically locally we chose the point around the spine, lumbar sacrum area. Especially with palpate found out the trigger point for the erect spiny and the multifidus. Then as far as the distal point, we use the DO 26 because that is related to the spinal problem, the DO point problem. And with a distal point, as a patient have stretch and exercise, immediately he can get up. I mean, straight his back. When he come in, he barely can walk properly. But immediately we put the needle in, he feel pain relief. And when we had the patient perform some flexion extension exercise, he can immediately straighten it up. He's so surprised, and she's so surprised. He's a quite tough athlete, and but immediately with our acupuncture treatment, he can straighten up. Then later we perform some manipulation, including acupressure and some tuina. Of course, for me, I'm also a chiropractor. I have a license here. I do a little bit like thoracic compression and lumbar sacrum rotation adjustment. Immediate resolve the problem. Yeah. That is a spine problem. And we can even patient have like a acute problem. We can achieve immediate result. And a lot of times the patient have like a chronic problem. Sometimes recurrent from the old injury. We also can have a very like instant result. And because we treat more cause, so later the recurrent the case will be much more we can avoid. And then this patient, the patient, they have like not very much degeneration in the bone part of the spine, but the patient have the like a muscle problem. It's not just a big muscle like erect spiny, but also multifidus muscle, which is contribute more to the chronic problem. Yeah, the core muscle, right? Yeah, multifidus is one of major core muscle along the back. So acupuncture here is not just treat the acute pain and muscle spasm, but also we treat the cause. And later, as a patient have more exercise to strengthen the muscle, which is in turn treat the cause, strengthen the muscle and spine for long-term result. And that is that this case is acupuncture for the spinal problem. Then we have some problem from other part of your body. For example, here this patient have the foot pain. Same patient, he had a foot pain and a very kind of like acute from his right foot, the medial side of right foot. When he do some training, she kind of like stretch his left leg with the foot evert, or evert. Then all of a sudden you feel pain, and the pain is constantly, and like although there's no radiation, but he cannot run. It's locally, but he cannot run. And because every time when he run, it's aggravated the symptoms. So this patient come to see me. We found out he not in this picture we can see her right foot kind of got a little bit flare out. And it's not just a foot hair problem. You can see her low back actually have related change. Here we are. We use more like a diagnosis, other diagnosis tool. You can find out that this foot, right foot, a little bit flare out. Use the foot leveler. We check the pressure in foot is not even. We try different type. You can see that right foot have more weight on it. That's a big difference. Actually, we try use acupuncture and different acupuncture method on this patient. We got no relief. Then we analyze whole body, found out the patient not just have a foot problem, but you can see there's a not balance. Right foot have more weight than the left side. So through analyze the distribution of the foot weight, we found out she has problem more than foot, but including his low back. We know that the patient have like a S shape of the spine, and the foot is actually, the pelvis actually tilted. You can see here. We don't have much time to explain, but here the picture say everything. So although we cannot treat with acupuncture, and but we do a little bit like adjustment, like a foot, and not just foot, but also pelvis. We found out a very simple adjustment from the foot and SI joint. Then the patient foot pain resolved. So what I want to say here is we don't want stuck on one method, and we can use other method like manipulation, even adjustment, or exercise. All these they put together can optimize our technique and reach the maximum result. So AcuCare therapy, here we are, is not just help you with the simple and the problem, but a lot of times a very the difficult case we can solve with AcuCare therapy. And not just for me, and for my student, it's also easy to learn and simple to do. Yeah. All right. My scenes here is already finished. And do you have any question? You can let me know, and we can discuss more in detail. Thank you for your attention. Thank you. AcuCare therapy. Thank you.
Thanks, Dr. Ouyang, for your wonderful speech, and thanks for your knowledge and to sharing knowledge and experience. Okay, thank you.
Thank you.
And then our next speaker is Shulan Tang. So let me briefly introduce Shulan Tang. Professor Tang is an eminent clinician in traditional Chinese medicine and an educator in Chinese medicine. She has unique therapeutic effects in the treatment of various difficult and complicated diseases in gynecology, internal medicine, pediatrics, dermatology, post-COVID-19 sequelae, etc. So Professor Tang, her topic for today is the individualist treatment plan for diabetes, integrative approach of TCM and Western medicine. Professor Tang, please start.
Thank you for Dr. Shita's introduction. Ladies and gentlemen, I'm so pleased to see you here today. First of all, I'd like to thank Professor Chen Gangli's invitation. Now, I'm going to talk the individualized treatment plan for diabetes and the integrative approach of traditional Chinese medicine, TCM, and Western medicine. These are the main contents I'm going to talk about. The concept. Definition. Diabetes is a systematic disease mainly caused by the sugar metabolism dysfunction due to an absolute or relative deficiency in insulin secretion in the body. The main clinical symptoms we know that is for the blood test is high blood sugar. The symptoms traditionally diabetes in Chinese medicine we call is 消渴. 消 means consume a lot. The main characteristic of the symptoms of diabetes are 三多一少. It means 多饮多食多尿, 体重减少. It means main symptoms of diabetes is this patient suddenly drink a lot, and eat a lot, always eat very hungry, and a lot of urination. But one reducing is the weight is become thinner. So eat, drink a lot, urination a lot, but thin. That is the main symptoms, typical symptoms of diabetes traditionally. But actually nowadays, we can see in the clinic, when people suffer from diabetes, they are not only thin, skinny, a lot of them are overweight. There are lots of overweight. In the clinic, my patients who are suffering from diabetes, who are many like people like taxi driver or IT engineer, or they sit all day, lack of exercises. So there's usually they're overweight. So this is can cause further issues, like also can see there's protein in the urine and fatty liver, high cholesterol, etc. So diabetes, we can see all ages, come from kids, babies, children, toddlers, youth, and adults. But between the adults, men suffer more than female women. And in the 2016 WHO's report showing there are 422 million people affected globally. Projected by 2035, there will be 592 million people will be affected by the diabetes. The diabetes is ranked as the number 8th leading cause of death. So it's a very serious issues. And in TCM, because in Chinese medicine, we call it 消渴. So there's classically we differentiation divide into up 消, middle 消, and 老消. Up 消 means in the up jaw, many showing thirsty, drink a lot. Middle 消 is in the middle jaw issues, and main symptoms showing hunger, feeling, constantly eat. And the 老消 is in the kidney and the blood system, and actually keep urine, frequency of urination. That is classic TCM differentiation. And the Western medicine, they divided into type 1 and type 2 diabetes. Type 1 is also known as insulin-dependent diabetes. So there's the cause is when the body produces little or no insulin. And it is an autoimmune disease. So currently, there's about 30 million people with type 1 diabetes. This only approximately accounting for 10% of all diabetes cases. Well, the type 2 diabetes, it's mainly due to the there's having no pathogenic changes, but there's beginning with abnormal insulin resistance, and or sensitively insulin. Insulin is like not blood pancreas doesn't secrete the insulin properly. It's not absolutely no insulin, but it just can be ups and down. So we in the clinic is referred to as no insulin dependent diabetes. More than that, the overweight obesity is one of the main cause of insulin resistant, like we cause of this type 2 diabetes. And also there's chronic inflammations, like chronic inflammations in the body, also one of the cause of the type 2 diabetes. And it counts about 90% of all diabetes cases are due to the type 2 diabetes. And there's pregnancy diabetes. So that when the woman pregnancy, the kidney qi deficiency will affect the pancreas function. So they are showing the pregnancy diabetes. But as soon as the woman give a birth, when the kidneys of the heavy load, the qi is recovering, so it can disappear. So that is pregnancy diabetes. In the clinic, I see a lot of patients due to the stress, shock. So lots of patients have diabetes when they have this car accident also, because lots of patients come for aches and pain. Like before, Dr. Hui already talked about back pain treatment. It's a common condition in the TCM clinic. When patients come for aches and pain, after a while, often patients are very pleased to report us, oh, the pain's better, energy is better, and the blood sugar is back to normal after all the acupuncture herbal medicine treatment. And the patient will say because he has an accident and caused high blood sugar, after all body become balanced, the blood sugar back to normal. And also other different types of diabetes, yeah. And there's a complication of diabetes. If we leave it alone, they can have lots of complications, cause eye problems or kidney issues, or the nerves pain, or diabetes feet, like ulcers on the legs, or heart disease, or gums disease, or osteoporosis, the bones problems. They all relate to the kidneys function and the spleen and the liver as well. So this is about generally about the diabetes. So like etiology of types, they have the children and adults, and we have this insulin type 1 or type 2, or insulin dependent or non-insulin dependent diabetes. Type 1 is less, type 2 is more. Type 1 is only like 0.1%, right? Type 2 diabetes can see in male 6% and in female 5%. The criteria of diagnostic of diabetes according to WHO is, and if there's empty stomach, this blood sugar more than 7.8, or after meal the blood sugar more than 11.1, is can diagnosed as a diabetes. So what causes the diabetes in the TCM though? So we know this one cause is irregular, improper food, dietary, eat too much fat food, less fruits and vegetable, and fatty, greasy food, yeah, sugar, cakes, lots of, yeah, we know what is called junk food. So second issue is emotional. The stress and depression, stress, liver cheese stagnation, also one of the cause, because liver cheese stagnation can affect the spleen, cause digestive issues, problem. And also another cause is kidney deficiency. It's due to overwork. Old days, people, we didn't have car or phone, so we always have to work hard and a lot of labor work. But nowadays, people still can be overwork, overdrained kidney essence and kidney qi due to go to bed late, play too much games or too much time on the phone, and especially young people, they don't go to bed early enough. Or another cause of diabetes, called kidney deficiency, is can due to excessive sexual activities. So we have to mention to patients, yeah, that is all cause that we have to search for TCM diagnosis. So overall, 消渴 is mainly due to the indeficiency and the dryness. And the root cause of 消渴 diabetes is indeficiency, and the branches dry and excessive heat. They all interact each other. Well, during my personal, my own clinical experiences, I summarize that, and diabetes patients mainly due to root deficiency and branch excessive. Root deficiency is due to the pancreas secretion function is low, is weak, is due to the pancreas body, the qi deficiency, and is closely related to the digestive system, related to the small intestine and spleen and the stomach's function for digestive system, and also deficiency of the kidney and spleen qi deficiency or kidney insufficiency resulting in the empty heat, empty fat, and this type of person, mainly they are thin, skinny. But branch deficiency, the branch excessive is mainly we can see the liver qi stagnation and the blood stasis, and can see the old body constitution. It means the liver always worry, very thin body constitution, and or neutral, or hot or cold type. So have to differentiate what type of body, hot or cold or neutral, or if there's a spleen qi deficiency, so if there's a damp phlegm or obesity or cold type or blood heat or damp heat in the lower jaw or due to the excessive heat or inflammations. And like differentiation of diabetes in TCM, my own differentiation is type 1 diabetes, mainly according to the root deficiency, there's kidney and spleen qi deficiency, qi and yin deficiency, and sugar metabolism is low, is weak. And type 2 diabetes mainly due to the excessive branch. And liver qi stagnation and blood stasis, phlegm damp stagnation and damp heat in the lower jaw or disruption of sugar metabolism. Can be low, can be high, can be ups and down, like the sugar metabolism. So the treatment of the diabetes, Western medicine is mainly, the main treatment is metformin for the type 1 diabetes. They always own that, yeah. But if for type 2 diabetes, take metformin, but they are always long-term taking may cause the kidney function failure. So we have to check regularly. And type 1 diabetes, main treatment can be insulin injection. The TCM differentiation according to upshot, so mainly due to in the lung heat and dryness. So when thirsty, we need to clean the heat and moist the lung, and use a decoction modification for white tiger and ginseng decoction. Because of time limited, I only say the prescription name and the ingredients. We can read the PPT afterwards if anyone interested. So if middle it's the main symptoms due to the thirsty, hunger all the time, want to eat. So that is in TCM, we record the stomach heat and cause the yin deficiency as well, and decoction modification, 月女经, to clean the stomach fat, purge stomach fat to nourish the yin. And Lao Xiao is in the kidney and the blood, and the main symptoms is frequency of urine and tiredness, sore back. And so main treatment is to nourish the kidney in decoction modification of the 六味地黄丸. So now I'd like to emphasize my own treatment plan. And over the 8 years clinical experiences. I've been working in Manchester, UK for 34 years. And before that, I was working in China hospital, TCM department for 4 years. Over like 38 years clinical observation, I analysis and summarize diabetes as still root deficiency branch excessive, and type 1 diabetes mainly due to the deficiency, and type 2 diabetes mainly due to the excessive type. But all the diabetes patients often see mixed of the deficiency and excessive hot and cold in one person, all mixed up. So we need, but we need to make the individual treatment plan. Based on the Western medicine treatment and TCM classic upshore, midshore, and longshore differentiation treatment are according to individual body constitution and to measure the individual person and make the differentiation as the kidney insufficiency. Like this, mainly 5 types. This is my 5 types of differentiation. Kidney indifferentiation with excessive heart and liver fire. Spleen and kidney qi deficiency with excessive phlegm dumplings. And the liver qi stagnation with blood stasis. And the qi and insufficiency and with dryness in the lung. And also damp heat in the lower jaw. According to that, we set up the treatment principle. Yeah, these all treatment principle. Let's go through what they are. So type 1 is kidney insufficiency with excessive heart and liver fire, mainly obviously main symptoms of high blood sugar, and you can see insomnia, thirsty, and high blood pressure or constipation, right tongue less cut. So we treatment is nourish the kidney in and comes liver fire decoction. Too, and also modification as well according to different symptoms. We can modify them. If the heart fire, mouth also we can use 淡竹叶, etc. If high blood pressure, we can add the 白吉利 and the 菊花. Second type is spleen and kidney qi deficiency with damp phlegm. So mainly showing high blood sugar and often accompanied with unactive thyroid. Tiredness, very tired, and not really necessarily hunger, eat a lot. Some of this type might be no poor appetite, bloatedness, sick, and lose store or bulge or sort of spleen qi deficiency with pale tongue, with teeth mark, and white coat. So then we need to strengthen the spleen qi and tonify the kidney qi, dry the dumplings and resolve the phlegm, and use modification of 杜牛白术 decoction, and with modifications as well. Third type is liver qi stagnation with qi and blood stasis, and high blood sugar with depression and stress, and also tiredness, ribs region pain, and insomnia, and darkness color on the legs, and purple spots and patches on the tongue, and or hesitant pulse. Treatment principle is to soothe the liver qi and harmonize the qi and the blood, and unblock the blood stasis in the channels. And we can use 盐湖龟勺 decoction modification. Fourth type, qi and insufficiency with lung heat and dryness. High blood sugar with tiredness and thirsty, dry cough or night sweat or sore throat or dry skin and itching skin, right tongue with cracks and no coating. treatment principle is to tonify both qi and yin and to help to produce the body fluid and to moisten the lung. So we use decoction of Suan Gan Hua Yin Tang and sweet sour together can produce the body fluid and with modifications as well. Fifth step is large intestine and stomach heat, and with damp heat flow of the turbid dumplings downwards. In the urine, can see cloudy urine, turbid, high blood sugar, and can see hunger feeling and constipation and cloudy urine and bloatiness in stomach, headache or strong smell in the breath, yellow greasy coat and sleepy rapid pulse. We have to clean away the heat and eliminate the dumplings. We can use Huangqing Bixie decoction modification. So this is my 5 main differentiations and treatment principle and herb prescription and herb ingredients. The key points of the in the clinic how about choose herb medicine is because one, diabetes is a very chronic condition. It's not like a virus infection, bacterial infection, have to quickly solve it. But this we have to long-term watch to make sure body in good balance. The herbs always have to use something quite soft, not over hot, not over cold, not over dry, and not over purge. Just make bodies more balanced to keep the body good immune system and maintains blood sugar metabolism. And often say the diabetes like the autoimmune system, but if the immune system low, and that's mainly due to type 1 diabetes or qi and deficiency of kidney and spleen qi, we need to tonify. And if the immune system is sensitive or allergic or overactive, so it's often due to indeficiency with empty fire or heat. So we need to calm the immune system down. Sometimes the immune system's ups and down. That is often due to the liver qi stagnation. When the liver is happy and not stagnated, so the immune system is okay, and the liver is angry, liver qi stagnation, liver yang rising or high blood pressure, and the immune system become high, so we need to calm it down. So all according to TCM. And also, how can we prevent it? So apart from treatment, and so we also need to tell diabetes patients how to look after themselves and have a happy mood and do exercises, have plenty of sleep and some exercises, and don't drink or smoke too much, not over late night. And also can choose some, if they don't want herb medicine, they can choose some herbs as a dietary advice. But this also have to according to individual person. If the yin deficiency, can use Yu Zhu Huangjing. If they are damp, can use Yi. If the blood stasis or heart problems, we can use dancing or Goqizi Shuanyao for all sorts of body constitution. Goji and Chinese yam. And overall, I really like how to strengthen our immune system to prevent diabetes or maintain the sugar metabolism. Linzi is like my favorite, and also in the Ben Cao Kang Mo recorded linzi is so good for immune system. It's not too hot, not too cold, can work for all sorts of type of person. But on the Ben Cao Kang Mo record linzi has 5 color linzi: blue linzi, red linzi, yellow linzi, white linzi, black linzi. So that's accordingly, and then work on the different organs. So, but now this is I wrote the linzi according to Ben Cao Kang Mo wrote poem as a gift for the Menghe doctor scholars in Changzhou, my hometown, because Menghe Yipai is it's like a 老中医 TV series. It's based on the Menghe Yipai. That is Lin's poem I wrote for that. So thank you very much for listening.
Okay.
Mm.
Okay, thanks, Professor Tang, for your excellent speech and for sharing your knowledge and experience. Thank you again. Thanks.
Thank you. Let me get off.
Okay, now our next speaker is Professor Chang Qingyang.
Hi, I'm here.
Okay, so let me briefly introduce Chang Qingyang. He's a doctor of medicine, a bachelor's and master's degrees in TCM and California licensed acupuncturist. Dr. Yang is currently the president of the American Institute of Mental Health in Traditional Chinese Medicine, the deputy director of Chinese Mental Health Professional Committee of the TCM World Federation, and has established a mental health expert studio in China. Dr. Yang, his topic for today is TCM mental health preservation for people over 50s. Now, Dr. Yang, time for you, okay?
Okay, thank you. Thank you, everyone. It's a great opportunity to share something with everyone. Today, I'm not focusing on something like clinic, do some needles, herbs, make something better. I don't want to do that. Today, I want to share some of the topic that's related to our medicine, the traditional Chinese medicine, the certain theory, also very important, the concept. So in the Neijing, we have so many the talking we have to know. It's not just something you can understand from the surface of the language. Also, you have to understand the metaphor, also called read the meanings between the words. That's very important. So today's topic, I'm focusing on TCM mental health preservation for people over 50 years. Okay. So that's today. Why are we talking this? Because currently we're living in the world still with focusing more on the physical based. That's kind of the concept. Sorry. So in the clinic, many practitioners not really pay attention on the mental health, and even not pay attention at all regarding the patient's psychological aspects. And also, I know many doctors, due to the education, the style or curriculum based. So that's why the people more focusing on food pattern. They don't know what is the Shen. For example, they use liver qi nation, hot fire, flame sting, qi blastination, this kind of thing to think about that's the Shen, but that's not the Neijing original idea. Okay, now we have to pay attention on the body and the mind, and how the age related these kind of issues. And in the Lingshu, we call it 天年篇, the natural lifespan. Actually, that's the comprehensive translation, but actually the lifespan means the life expenditure or life longevity meaning, the natural life longevity meaning. Because this kind of translation, if you're talking lifespan, the lifespan, how long? They said 100 years. That's it. You're talking about natural lifespan, that's limitation based. But I still make it its name right here to matching the general people talking. Otherwise, I always do something different. So life 10 years means natural longevity. Longevity means, for example, we have the theory related. 60 years old is one cycle. Exponential, that's called a 指数. Exponential, so 60 second exponential 120, third 180. So 内经 not just telling you 100 years old. If you overcome some difficulties, you maybe can live in more 60-based, exponential-based, that kind of longevity. Okay, don't talk too much there. So we're talking here, they call it when we were born, when we had this kind of life start even in the womb of the mom. So that what happened internally? So the blood and the qi have been harmonized. The yin and the wei have been going through. The 5 organs have been formulated. What does it mean? That means the house created, the structure made. Now they made. Then what happened? The shen qi have coming into the heart. The shen qi coming into the heart, that's called originally called shen qi she xin. The shen qi coming into the heart, that's the house, that's our body, that's the jing. And then the hun and the po has been completed. It's already to use. Then you have become a human being. So ask is the shen, answer is a human being, or person, or man. So that means what? That means the shen is alive. If you don't have shen, there's no life. So shen is life. Put the qi together, that's life qi, life energy. So I keep talking this. And also talking about when the 5 organs are strong and the blood and the vessels are harmonious, the muscle and the are healthy. The skin is dense. The yin and the wei functions does not deviate from the normal the state. Because in our medicine, we know the yin cycle 50-50 during the day and the night. So that's one cycle. So everything we call it Dao. Now we call it Dao. So the 6 full organ transform into the grains and the body fluids spread all as Europe, so it can live for long life. So very important, Neijing talking something very simple regarding human life. So everything you keep a normal flow, follow the natural energy trending. If you can do so, you keep the Dao working, your longevity should be fine. I had 2 weekends, 2 Sunday 8-hour talking. It's too much talking. So that's why today I have still the throat not so great. Okay. And in the same chapter, I quickly to give you some of the from the 10 years to the 4 years. Neijing talking the 10 years old, the 5 zang organ begin to settle. The blood and the qi have been channeled, and the qi is in the lower body. So they like to run. So if you are, we say around 10 years old, what happens? The qi energy is much more on the lower body. So for the kids, there are no stable walking base. You see the kid always running, make a big noise. Why? That's the energy based. So at age 20, the blood is beginning to flourish, and the muscles have just grown. So they like to walk fast. So young people walk stable, no more that kind of impulsive running or do something ridiculously. But for 20 years old run, they walk, but they're fast. Meanwhile, indicate young people less patience. At age 30, the 5 internal zang organs are fully developed. The muscles are strong and the blood vessels are full. So they like to walk. 31 years old, they start to walk stably. So that means the 30 years old, we can stay alone, essentially. So they like walk and walk stably. For human, around 30 years old, psychologically also, you get the maturity better. At age 40, the 12 meridians of the 5 zang and the 6 full organs were all prosperous and stabilized. And the body strain was beginning to be sparse, smooth appearance fades away. The hair is gray, stable, and healthy without swaying, and they like to sit. So 40 years old, we are in the peak, start to turn around. That's why Simon showed the gray hairs. and it got more matured, more patience. The actions around 40 years old, they try to find a way to say, okay, let me sit down. No, that means let me slow down. Let me take a look. That feeling. Okay. If you reach the 50 years old, that's very crucial. So what happened? Because when the age reaches 50s, the human body has entered called a downward path. When I say downward path, you have to know human being alive started from the east direction, the young rising direction. So when our body slow down and get weakened, also slow down from the east. That's the 50 years old. That's the liver start decrease the energy. So that's why human life activities begins and decline from the east. So at this moment, this age, very important, we have to take care of our liver. So that's why Neijing talking about that the essence of the liver begins to weaken. Bile secretion decreases. The eyes begins to become dim. Physical and mental strength decreases, and the activities and of spirit and energy weakens. Also, the physical exercise should be more conservative to prevent accidents. You know this, right? Because liver on the east rising, moving, also have confidence, you take action. That's all the liver does. You have to think about the liver connected pattern is wind energy based. On the earth is wood energy based, growing and moving, take actions. That's like a body. The liver is tendons based. So you have to keep moving. Also on the rising directions. So that when they have anger, it's not a liver qi stagnation. That's a wrong diagnosis. The Neijing mentioned the liver, that anger makes the qi rising. The majority of patients will have the anger. When I have the anger, I know that's the liver qi overly rising based. It's not liver qi stagnation. That's a wrong diagnosis. So that's why. So this moment, don't overuse the body. Preserve the body energy. Slow down any activity, especially physical also. For the physical, that's we have to be very conservative. How about the mental? They're talking about as the liver qi begins to decline. Liver qi started deficient, right? Liver energy, right? Liver qi begins to decline. The general, the function is vacant. The pioneering and entrepreneuring, that's kind of spirit will be vacant. You're not trying to do, okay, let's do strong business. I have to put it in some kind of plan. I need to spend hours physically, mentally to work on something. No, that's not for this age. Thinking activities tend to be steady and conservative, paying more attention to the overall situation and the whole, and at the same time, young people are full of ambivalence about anxiety and expectations, right? Because that's the 50 years old. You don't have that kind of pioneer, that kind of spirit, or do something in adventure, though. But you start moving the eyes on the young people. You have your all expectations. Meanwhile, this age, the family, same thing. The family also, the kids grow up. You put your hope to your kids and to the young people. So pay more attention to health preservation and start to actively participate in the pay attention to health preservation. Since the age of the 50 is already the age when one knows destiny, it is very easy to judge things based on personal experience. So the 50 years old people can see the whole picture, not that impulsive, but meanwhile somewhat conservative, and it's somewhat more based on personal experience. That's the 50 years old. That's why when you try to control the big company, you try to manage the big business, you work on the bigger or very high rank position, the position or something, right? And you have more great rank or responsibilities. if you don't reach this age, normally you couldn't see the whole picture, or you don't have enough experience. That makes sense. No, it makes sense. They begin to feel how lonely as the children have lived home, and they begin to experience the pain of their own parents' death. So that's all around 50 years old. Especially today, when the parents has 30 or more years apart. In my generation, 25, 28, 27 years apart. Some of the family maybe only 21, 22, the age apart. But anyway, start 50s, you should experience such pain because parents start to leave, to pass away. That's why this age they feel the pain. That's the thing. Also, patients with a mental illness have generally become chronic, or their bodies have shown signs of a more serious decline. So generally, patients with a mental illness can age 20 years earlier, the aging, right? 20 years earlier than normal people, if someone has mental disorder. So that's why with a severe mental disorder, that's why they passed away earlier. That's from the doctor talking. So that's the real situation. Also, when situation chronically keep going, lingering until this age, their life function, everything can be very tough and very poor. Only rely on the family support because no insurance cover for your whole life. That no insurance in the world. So largely rely on the patient, family-based. So better we have to do the healing in an early age. But anyway, 50 years old, that's the turning points. Started from the liver. So the liver energy start declining. So physically, psychologically, we have such a problem. So 60 years old, the essence of the heart, right? Liver generate the fire, the wood generate fire. So liver generate heart energy. So when the liver energy in trouble, we have this kind of heart trouble. Even you're normal, but it turn into 60 years old, the fire energy starts to slow down. So which was known as the sign of the weak. Liver energy that would not generate enough fire, so the heart can be weakened faster. So that's why. And during the 60-year-old, when your heart energy not enough, what happens? From the Neijing principle called the heart, the Shen Qi, right? They call it Shen Qi. The Shen Qi, if enough, you're laughing. If not enough, you feel sad. So during the 60 years old, some people start to turn to review their life, and they feel the death, talking or thinking about the life, the end of the life, and they even feel some the sadness. That's kind of pessimistic, we call it pessimistic certain view regarding the human life. And also in the same time, they feel energy slow down, and they like to lying down or resting for 6 years old. So that's why in general, if you have a strong body, you walk very steadily, and you take the bus, drive your car, you go everywhere, you feel good, congratulations. You have good 60 years, you should have a good 70 years because you slow down the process. But in general, people feel very tired. They lay down the sofa, lay down the bed, they want to take a rest. And meanwhile, around 60 years old, the parents in general is no more exist. So their lonely journey started from this age in general. Okay, so the ability to respond for things decreased because we call the 心神应物, the heart shen response to things. But in the 60 years old, they start to slow down. They don't want to observe something new or learn some new technology. In general, it's difficult. But overall, they try to searching there something beside themselves, like a family member, friendship, healthcare, medication, retirement. That's very close to them. They try to searching them. Because the 60 years old, the Shenxi activity largely slowed down. Their desires, everything also slowed down. Motivation weakened. And in general, 60 years old, when something happens, they easily make the compromisation. They don't want to make things worse or bad. So that's the 60 years old. At the age of 60, the man begins to experience the sharp decline in sexual functions and the accelerated decline in physical condition. From males who are suffering during these years. Female after 49, the having water, 天癸, having water, the kui water, slow down, normal menstruation, but overall maintain this body steady. But the male in the 60s, age 64 years old, the body decline very, very obvious, quick. So that kind of thing. For male, loss of sexual function, loss of physical power is the biggest thing. It's a big thing. So that's why facing the retirement and the lifestyle changes, the third generation appears, and therefore they will face the challenge of accepting their old age status. For a female, they watch the mirror to see their appearance. They feel sad or want to stop the aging, but the male different. Male basically, if the function is not good, the body really starts deteriorating. That kind of pessimistic thinking, psychologically shock, it can be tremendous. So due to the difference in the social environment, healthcare, and one's own economic conditions, so people's mental health status will also vary greatly. So you have good financial support, you can maintain yourself well. But for many patients, they don't have that kind of support. The situation can be very, very tough. So some people will lack self-awareness of their mind, have persistent personality defect, and may also suffer from this, the senile depression, anxiety as well. So for human being, we keep growing ourselves, meanwhile we remedy ourselves. But unfortunately, we have some kind of personality defect. Even until this age, they still have this kind of trouble. That's why during this moment, it's still anger, aggressive, or doesn't know how to review, to remedy themselves. So that's why they start depression, anxiety, or senior, that kind of loneliness, no friends, no friendship. That can be suffer more. Clearly, male much more than female. So 70 years old, what happened? So the fire, not the general earth. The human body continue to decline, especially when the spleen is weak, because earth energy slow down, follow the generating sequence, which is the sign of the heart energy is insufficient. So it does not generate the earth. So spleen is weak, what happens? Our body quickly see the muscle atrophy, normally start this age. 70 years old, doesn't matter what you do. You want to recover the muscle mass like a younger age, no way. But we have some, but that's the extreme case on Europe. But in general, people slow down, muscle, skin, everything, weathered. So the tone decreases and the skin begins to weather, which accelerates the aging of the human body. So that's the reality. The ability of the thinking and the idea is reduced. And the various activities such as the learning ability and comprehensively reduced. So people, they say in general, normally hard to learn new things. But remember, we have someone 70 years old still come to the community college, start something new. But that's not, obviously not Europe. Everything has extreme case, exceptions. So their lifestyle have completely changed because this age, the people fully retired, follow any type of retirement based. But if your body is good, such people, someone still go back to work on something, make an income, or due to the financial situation, or think they have something fun or interesting. So during this age, if you still can enjoy something or find a work you can do, congratulations, it's wonderful. But anyway, 70 years old, spleen chi energy is weakened. So during 70 years old, if you can eat enough, enjoy the food, you still have the taste, you feel delicious. Wow, congratulations. You are the person absolutely with a great longevity ability. And this is the stage of where people begins to summarize and reflect on their own lives. Therefore, the people of this age will have the peaceful mind and often savor the past and they share their own experiences. That's why granddaughters say, hey, grandpa, you are talking the same story over again. Yes, because they try to review their personal life. Therefore, they often repeat the old story from the past and are difficult to develop the new interest. They become dependent on the social welfare and they also depend on doctors on this age. Especially when you have chronic situation, it depends on this kind of program. So that's 70 years old. So they're less sensitive or even insensitive to the political, economic changes in society in general. They're not really so sensitive. What they do, they pay more attention to our condition with their families and their physical health. So families where is the male died first are more common, and the population of the older, the women will increase significantly after 60s. When you go to any trips, you can find out around the 60s, the people is spared. After 70s, definitely male is decreased. More female, the travelers. That's very, very clear. They don't say, I don't want to say the female passed away, but the weakened, and they stay home or just try to take care of themselves in a certain way. So that's 70 years old. Remember, if you can eat, protect your spleen, that makes things much better. 80 years old, the lung qi begins to decline seriously, right? Because the earth not generate metal. So which is a sign of spleen deficiency at the age of 70, and the earth does not generate metal. So the octogenarian years, the weakening of the lung qi makes the body's Shen energy greatly weakened. The phenomenon of this separation of the Hun and the Po occurs. So the Shen energy flows and it drifts, and it's difficult to concentrate. For example, words are prone to errors, names are blurred, and the cognitive ability with the time to play is greatly reduced. So that's why people say the wrong words, wrong name, call daughter name to the second daughter, call the son's name to someone else, or couldn't remember your date or something. Yes, that's 80 years old. And relying on the help of others also requires intervention and help in various aspects of life. The chance of doctor intervention is greatly increased because I say 80 years old. When the body lung decreasing, energy decreasing, what happens? The lung energy is tough. When something happens, even just like a common cold attack, so the 80 years old people can easily pass away. And for this age, they almost have any learning ability, and they rely almost exclusively on experience based. So his body functions have obviously declined. So be careful on that. The occurrence of the various accidents. So they smoke very easy. Have any accident causing a lot of trouble, like fractures or some things. The mentality is already in the stage of the complete tolerance and indifference. Due to a severe decline in memory, the general mental state is very calm and peaceful. So the person's health regimen has become a personal lifestyle, which is difficult to change. Who asked you stop smoking, drinking for this age? No way. Don't they eat blah, blah things? Oh, no way. Don't they eat the salty things, blah, blah. It's difficult to change. That's old generation people talking, right? So the health of the body is seriously weakened, and the person dies quickly. If in this age something happened, it happened very fast, very fast. Now, except you have a chronic or minor linger from the 50, 60, 70, right? So if the body is still healthy, you see the neighbor, your relatives, you check it. When these kind of people have something happen, they pass away very fast. Then the last, we're talking about pandemic, many 8 years old, the seniors, the lung is weak. So something happened, they pass away just days, very fast. 90 years old, what happened? So kidney, when the essence of the qi in the kidney is being full, which is the sign of the lung qi deficiency, and it decline at the age of 80. So the metal does not generate water. So that's why. Because this is the last 5 internal organ. So the state of the essence in the kidney, it means that the resource of life is exhausted. And both the yin and the yang energy are in a state of deficiency because it's the final organ. The mobility of the shen qi is extremely weak and atrophied. And the physical strength is seriously reduced. This group of people has lost any ability to work, but can enjoy life, thanks to the fresh air and food every day. So that's their thinking. There are no more any strengths can do something physical even. If this age, they can take care of themselves. Congratulations. You should be very good. So they're happy to see their children and grandchildren growing up and feeling centered. No, that kind of feeling. No. They are no longer afraid of death and they can spend every day with a peaceful mind. The attenuation of the Jing and the Qi and the Shen greatly reduced memory and the thinking ability. So the dementia caused by the deficiency of the Shen Qi is significantly increased in this age. You don't need to have to diagnose some dementia because it's aging. The caring of the family and the loved ones is very important. Even if you can't sleep in the night, you can still do what you can. Being highly respected and loved, life is more fragile and often prone to organ failure and death, or death without illness. Just last moment, breathing out, that's it. No. So finally, the 100 years old is the natural lifespan. It's the ideal period of life, according to Neijing. The 5 internal organs and the essence of the human body have been completely exhausted, and it is difficult to maintain the Shen energy. The activity of the Shen Qi are often based on the internal fantasies for fun because the people still that can functioning. The mobility of the Shen Qi still exists. They can still feel the care of the outside world and are grateful for everything they have experienced in life. Smile and calmness are the greatest expression of the happiness. They have long ignored the danger of the death that may come at any time and accept any situation very quietly and peacefully, even the possible end of life. So that's the 100 years old. Thank you very much, everyone. So that's my talking today. Thank you for the opportunity. Bye.
Thank you, Dr. Yang, for your excellent sharing your knowledge and experience. Okay, thank you again. Okay, so now our next speaker is Professor Dr. Tianjun Wang. Okay, welcome. Professor Tianjun Wang is a principal of London Academy of Chinese Acupuncture, guest professor of Nanjing University of Chinese Medicine. So Professor Wang has authored and co-authored more than 50 academic pages as well as peer reviews to many international journals. His authored book, Acupuncture for Brain Treatment for Neurological and Psychological Disorders, published by Springer 2020. Today, his topic is brain acupuncture for Alzheimer's disease. Dr. Wang, please start.
All right. Thank you, Dr. Xu, introduction briefly of me, and thank you for the lovely, fantastic talk by the Professor Joseph Yang talking about the life. We hope we all can achieve the life in 100 years. So thank you very much. So now my talk is, this short talk is about the brain acupuncture for Alzheimer's disease. And my background, I do not to repeat. At the moment, my main job is a principal of London Academy of Chinese Acupuncture UK and the director of TG Acupuncture and Brain Center. And has introduced my book about acupuncture of the brain. This book has detailedly introduced my theory and about the brain acupuncture, including Alzheimer's disease and other dementia. If anyone are interested, this book is a detailed reference. And before we start talking about the Alzheimer's disease, I'd like to share some new research about the scalp acupuncture mechanism. This one has published in less than 5 years. There are several hypotheses of brain acupuncture hypotheses. The majority of this hypothesis, in my opinion, is the brain electrophysiology. If anyone are interested, can make a further reading. And this recent research from the China Academy of Acupuncture to identify and summary about the shortcut pathway between the scalp acupuncture and brain that make it clear. And the scalp acupuncture can have a very directly and shortcut pathway to stimulate underneath the brain function zones. And of course, there are lots of other research has indicate the stimulation on the surface of scalp have the better result for brain function zones. And also lots of research on EEG to indicate scalp acupuncture and body acupuncture points that can reduce the absolute power of the frequency bound for the epilepsy patients. So that therefore improving symptoms during an epileptic seizure. This also indicate acupuncture and scalp acupuncture plus electro will not the cause epilepsy seizure. They can reduce the epilepsy seizure. Can help us understanding. Here, scalp acupuncture also recently, by my research, I have done lots of speaker. That means scalp acupuncture application can be related to the most high technology called brain-computer interface. Yeah. This kind of the brain-computer interface collect our brain signal through the receiver, and it can analyze it by computer. On the other way, these activities can be regulated by the computer, or from scalp acupuncture, we can apply the stimulation on the scalp, which generates the electric signal to the brain, similar to the brain-computer interface. You can see the left-hand side is the scalp acupuncture. After fast manipulation, can apply electroacupuncture, which is very similar to the right-hand side, the EEG, which is the base of brain-computer interface, 脑机接口. When we're doing scalp acupuncture, we need to generate a fast manipulation. The request for the fast acupuncture needling is 200 manipulations or movement per minute, which equally to 3 to 4 movement per second, or we can say 3 to 4 hertz per second. This fast manipulation can generate the electromagnetic signal to stimulate the brain. This is one of the key factors for the effectiveness of scalp acupuncture. In summary, for scalp acupuncture to achieve the better result of scalp acupuncture to treating brain-related conditions, including the Alzheimer's disease, including the selection of right appropriate scalp acupuncture areas, then fast insert needle in the certain depths and layer, and of course to faster remove, the twist or rotate needle can generate the electromagnetic signal, which these 3 steps are the key factors to achieve better result of scalp acupuncture for treating brain conditions. In terms of the brain acupuncture, we call the brain acupuncture for Alzheimer's disease. The brain acupuncture is one of the fast and rapidly development or improvement in the last 3-4 decades in the TCM acupuncture area, which unluckily is not well introduced in the Western countries, as many of our colleagues migrated to the Western countries in 20-30 years. In that moment, brain acupuncture is still undeveloping. And also in the Western countries, in most of the acupuncture school, acupuncture university colleges, etc., they do not introduce this kind of the new developed theory and technique in Western countries. And so in the last couple of decades, about 15 to 18 years after I moved to the UK, I based on my PhD research, acupuncture for brain, for scalp acupuncture, and for the depression, I have already summarized, introduced this kind of new acupuncture science and technique to the Western, including brain acupuncture. If we summarize the key points of brain acupuncture, which including, first of all, the first point of all is TCM has a brain, and the brain is above other Zhang organs. As you know, traditional acupuncture, we have Zhang organ, Fu organ, and extraordinary organs. That is a little bit too traditional. Nowadays, in the last say decades, nowadays the research indicate brain is a Zhang organ. It is even better, even above, higher than other Zhang organs. And the brain function, including control our life, brain regulate mental activities and our physical activity as well, including our vision, our hearing, our smell, taste, speech, intelligence, etc., etc. But brain is so important. So brain has its own meridian called the duodenum or gallbladder vessel, or we can shortly call it the brain channel. And brain is the sea of marrow, where it opens at the top of the skull and below at the Feng Fu 216, which is the key reference from Huangdi Li Jing, chapter 33, Hai, the sea of Hai, talking about the brain. And for special technique to treating brain, including scalp acupuncture and duodenum Dao Qi technique, are the special and highly effective methods for brain-related conditions. Let's shortly introduce about the condition we call the Alzheimer's disease and other dementia. As you know, and Alzheimer's disease is one of the type of dementia. So these two names should be careful about the conception, which means Alzheimer's is one type of dementia, which is the most common dementia. So dementia, there are many different types. The biggest type is Alzheimer's disease. The second is vascular dementia, and several other dementia. So we should be careful the terminology. In terms of the shortly introduce the dementia from the picture, you can see our neuron has been getting dying and dry with the tanglings, but our health brain size is much more rich and much more knowledge. But unfortunately, because of the plague, etc., our brain damaged, our brain neuron damaged. So gradually we lost our brain function, particularly our memory. Yeah. So can you say we say Alzheimer's is the most common cause of intelligent decline and the dementia in the elderly, affect approximately about 1 out of 10 people over 65, and nearly half over age 85. Professor Yang introduced, we all expect to look life of 90, even 100. That means after 85 years old, half of us will have the risk of dementia. So we need to pay our attention to look after this dementia for ourselves, our parents, and our patients. Yeah. And also interesting, the dementia affects women more frequently than men. There are many reasons. And the dementia characteristic by shrinking of the frontal and the temporal lobe. As you know, frontal lobe are majority related for our memory, cognitive, emotion, decision maker, etc. Yeah, and the nerve cell death in several areas of the brain, and lots of the key mental functions such as memory, learning, and concentration. Yeah, and dementia it's a very slow developed problem. As we mentioned, some patients, even from 40, 50, they have developed some of the symptoms. So in early stage, we said early stage, because dementia developed gradually, its early stage are often missed. The common symptoms including forgetful, loss of time, getting lost in familiar places. So sometimes we say when we after 30, after 40, after 50, particularly after for the women after the birth of children, sometimes we say one baby birth, then 3 years elderly. So that's partly the reason why women are more dementia than men. Yeah, and that's the early stage. The early stage could be start from 30, 40, 50. Yeah, even there are some real cases from 20. Some real case. But unfortunately, in the early stage, are very difficult to identify and diagnosis. But when we make to middle stage, to the stage, signs and symptoms become more distinguished and more limiting, such as forgetful of recently event and names, getting lost in home, not just outside the home, increasing difficulty communications. Need help from a person caregiver, experiences behavior changes, including wondering and ask repeated questions, repeat. But for the later stage, people with later stage dementia are almost completely dependent on others for care, including the loss of sense of time and place, difficulty recognizing friends and family, increasing need for associated with self-care, difficult walking, experiencing more behavior changes, which may including aggressive. And one of the biggest and social problem is the lost. The later stage, some dementia patients finally lost, which generates a big social problem for the family and the care. So, and one of the common questions asked by colleagues, friends, and students is how to identify the elderly forgetting or Alzheimer's disease. This is a summary. I make it based on literature review and my personal experiences as a sample, and the difference between the forgetful. For elderly, forgetful is the forgetfulness of things done is partially or temporary and can be recalled later. But Alzheimer's disease is completely. They can't forget. They can't remember. They forget and forget. They can't. They have gradually something like you got the wrap to wrap it on a paper, etc. So there are lots of them. Due to time, I can't explain more of them. You may read later. And as you know, very briefly introduced for Western medicine treatment. As you know, there is no effective treatment for disease. Although some of the current treatment often offer some of the symptomatic relief. There are some drugs, but for some simply relief. The most effective intervention for dementia available is symptom treatment for vascular dementia. So as I mentioned previously, the first and most common dementia is Alzheimer's disease. The second one is vascular dementia. Vascular dementia are mostly related for stroke, post-stroke. Roughly about 60 to 70% of stroke patients, they may develop for 6 months to 1 year, development to vascular dementia. But compared to the Alzheimer's disease, vascular dementia is more effective for treatment, including acupuncture. Yeah. So there are lots of acupuncture research for dementia in the last 2 decades, including the general acupuncture and more and more research regarding for the brain acupuncture. If you're interested, you may reference according to the research and my book. And one of the interesting research you can see, the functional MR study is said investigated the effect of acupuncture in dementia and minor cognitive impaired patients by combining fMRI and traditional acupuncture, and confirmed that acupuncture can activate certain cognitive-related region in Alzheimer's disease. And more often, luckily, just the last month, I searched and found a most new published paper, May 2025, published called The Potential Scalp Acupuncture and Brain Stimulation Targets for Common Neurological Disorders, including dementia. So evidence from neuroimaging studies, just published May 2025 by the group of expertise from Harvard Medical School and Beijing University of Chinese Medicine. They said, this is the literature review, including we have identified specific cortical targets for scalp acupuncture associated with 10 neurological disorders. Our findings are broadly consistent with currently scalp acupuncture protocols while introducing additional new stimulation targets, such as the inferior temporal grace for memory processes and angular grace gyrus for vascular attention, etc. So, of course, if we use the brain acupuncture treatment, there are some we call the general acupuncture treatment also benefit for dementia. We can still use them. This is the list of this general brain acupuncture. You can have an influence or in my book, but particularly for brain acupuncture, including scalp acupuncture and Dao Qi technique for treating Alzheimer's disease and dementia, such as if intellectual, cognitive, or memory decline, sleep problem, depression, anxiety, etc. We may use scalp acupuncture spread emotional area, head area, foot motor sensory area, central area. A little bit introduced here. Spread emotional area is completely new area, which only published by the Professor Shunfa Jiao, the founder of scalp acupuncture, on his second edition of scalp acupuncture book. But unfortunately, that is only in Chinese Mandarin. If anyone interested for this special new area for split emotion problem, cognitive problem, memory problem, you may reference with my book, which is called Acupuncture of the Brain. That is the book in the Western countries only introduced this new special area. And another area called the central area. This area is also a complete new area, which is my personal contribution based on the preview references and my personal experiences. On the left-hand side, you can see from the illustration, you can find that it's we call the spread emotion area, shortly SEA, which this area you can see it's exactly just above the frontal lobe. Yeah, of course, if the patient is suffering from the hearing problem, tinnitus, dizziness, you can use auditory area. If the patient with numbness, we can use sensory area and foot motor sensory area, etc. And also we can use the Dao Qi technique. Yeah, interesting people may refer to my paper published and my book. We may use this special technique, which is published by the first published in Huangdi Deijing, we call the Ling Shu Wu Duan 5 uneven, which called putting the needle slowly in and out, which is the Dao Qi, but that is not reinforcing and reducing, which mostly used for the 5 uneven Qi, which means to regulate the Qi, but not involve any reinforcing, reducing. Yeah, if anyone is interested for that. And Dao Qi technique majority used on the Dumai or governor vessel or on the Renmai, we call the cavalier vessel. So you may refer to further reading of my book. In addition, for for brain, as we mentioned, brain is the important zhang organ, which is even above other zhang organs. So, but unfortunately, so far there is no any textbook, whether it's in Chinese or in Western textbook. There are no any textbooks introduce the brain pattern differentiation for the treatment of brain conditions, including dementia. In my book, Acupuncture for Brain Treatment for Neurological and Psychological Disorders, 针灸脑病学. In this book, I highlight some of the brain patterns which could be used by herbal medicine and acupuncture. Related for the dementia, these 4 patterns are commonly seen, including deficiency of brain yang qi, stagnation of brain collaterals, deficiency of brain marrow, and disorder of brain shen. Yeah, that is the common pattern. And of course, there are some clinical tips or notice for acupuncture treatment for Alzheimer's disease and other dementia. First, for treating Alzheimer's disease and other dementia, of course, the early involved, the better result. Yeah, this could be think about if someone has the family history tendency. That means more possible easily suffering from dementia. Then we may involve the early stage for prevention. Hope for everybody can start to prevention earlier, and or for female, and particularly after the menopause, we need more careful prevent Alzheimer's disease. And of course, there are many tips. For treatment frequency, in my opinion, in the early stage, normally we more often, more better. In Western countries, we suggest in twice per week at the beginning for the first 5 weeks. Then with time, slow down to 1. We ask patients at least after 6 months to 1 year. Yeah, acupuncture can combine with other routine theories, such as cognitive behavior therapy, which is part of the talking therapy, physiotherapy, speech therapy, etc. And also above the brain-related pattern of dementia can be combined of classic TCM pattern. Due to the memory decreasing, patient missing is one of the major problems for the family and the society. More attention should be paid for severe cases. The summary. And due to time, I think I have only 2 minutes. So, and the short summary is different hypotheses on the mechanism of scalp acupuncture and the brain acupuncture have their own merits. So similar to body acupuncture, and brain acupuncture have a comprehensive effect, which means not only for brain, but also for other zhang organs, for all the other channel, etc. The stimulation of the brain by the electromagnetic signal, which generated by the rapid twisting of the scalp acupuncture needles, is one of the key factors of effective results. Which means when we do scalp acupuncture, not only put needle in shoot small needle in half chun, 1 chun, that is not enough. Quite often, some of my colleagues, students say, "Oh, Dr. Wang, I use these areas, but not good result." So the answer, I will say, first of all, that you choose the right area or right points, and have you insert needle in right ankle, the right depth, and have you generate fast the manipulation, or you can plus electroacupuncture. The Alzheimer's disease and dementia are very common and challenge of treatment. So we need pay attention to make right diagnosis and pattern identification to introduce for the patient, and of course we try to encourage the patient to keep continually follow our treatment, not only 1 or 2 sessions or even 10 sessions, but it's not enough. And brain acupuncture, including scalp acupuncture and the Dao Qi technique, etc., has the unique function for treating Alzheimer's disease and dementia. Of course, general acupuncture is good for dementia, but not enough. If we plus brain acupuncture direct on the brain, which can generate a fast and shortcut pathway to stimulate the brain to make a better results. All right, thank you. Thank you for invitation. Thank you for the hosting of the Dr. Xu. That's all for my talk.
Okay, thank you, Professor Wang. Thank you for your sharing. Lots of research for a wonderful speech, and thank you again. Okay, so today's lecture in the morning is stop here. So we'll continue the lecture in the afternoon. Start from 1:30. Okay, see you back.
Thank you. Bye-bye. I'm leaving now.
Good afternoon, everyone. We come back. Now we continue our online lecture in English. First, I will welcome Professor Yemeng Chen. Let me briefly introduce. Professor Yemeng Chen is President of New York College of Traditional Chinese Medicine, President of the National Federation of Chinese TCM Organizations, and the Editor-in-Chief of Journal of Complementary Medicine and Alternative Healthcare, and the International Executive Editor of Chinese Medicine and Culture. Today, Professor Chen, he will give us a topic from evidence to practice important protocols in migraine prophylaxis with acupuncture. Professor Chen, please start.
Thank you, Dr. Xu, and wish the 5th World TCM Acupuncture Week a success. So let me share the screen. Okay, in this opportunity, I would like to share some experience and the protocol, clinical practical protocol for migraine prophylaxis. First, I will introduce the basic information about the headaches. So based on the Merck manual, a headache was categorized by 3 kinds: tension headache, migraine, and a cluster headache. And a migraine is very commonly seen in the acupuncture clinic, and we should know more about this. So according to the International Classification of Head Disorder, the 3rd edition, the diagnostic criteria for migraine include migraine without aura, migraine with aura, or chronic migraine. So especially for chronic migraine, it's a headache suggestive of migraine of tension headache more than 15 days per month or for more than 3 months that fulfill the following criteria. So it could be occurring in a patient who has had at least 5 attacks, meeting the criteria for migraine without aura or with aura, or both. More than 8 days per month or more than 3 months, featuring migraine and with those above 2 types. And so those the basic the diagnostic criteria. The patient also has the visual problems, sensory, speech, language, and nausea, vomiting, photophobia, so all those kind of symptoms accompanied. So you're familiar with those kind of patients. So there are a lot of migraine triggers. So especially those kind of, you can see the alcohol, the smokes, those kind of perfumes, and very good chocolate, nice food chocolate. And this is Chinese food, and especially for the MSG, and that's also could be the trigger for migraine headache. About the coffee, and the coffee doesn't cause the migraine headaches, but if you are coffee workaholic, every day have 1 cup of coffee, and sometimes you have no chance to have coffee. That will cause the triggers. And this will see the pattern, the sleep pattern difference alternate. So like a nurse practitioner, they have a different shift, night shift, day shift every week, different. Those also will be the trigger for the migraines. Especially the recent stressful life and migraines actually is very common theme. So migraine are complex neurological events involving both neuron and the vascular mechanism. It's thought that the combination of genetic predisposition, environmental triggers, as I mentioned in above, and a neurological factor contribute the condition. These factors can lead to abnormal brain activity and affecting the nerve signals and the chemicals and the blood vessels, especially the trigeminal ganglion and sphenopalatine ganglions, and called dilating of the blood vessels, dural blood vessels. So that's the major anatomy and pathogenesis in migraines. So when according to New England Journal of Medicine, they have an article talk about the algorithm for the clinical management of migraine, including the first-time treatment and preventive treatment. Unfortunately, the acupuncture was not listed, mostly the chemical drugs. So I hope for the more clinical evidence, and we should have a consensus with those kind of algorithm, and that will be helpful to be a guideline, clinical guideline for acupuncture, what times and what to do. So that's important. And in recent years, lots of evidence talk about the acupuncture applied to treat the headache and migraine. So in Milestone Conference of Consensus Statement on Acupuncture in 1997, headache was listed as acupuncture may be effective as an adjunct therapy, an acceptable alternative, or as a part of comprehensive treatment plan. In 1980s, and the World Health Organization and the list of 43 effective indications for acupuncture was a very pilot study based on a pilot study, but very influential. At the time, I was still in China, but also has the knowing of this very important 43 effective acupuncture indications. In later 2003, they modified and added more, like 180 indications, and then relate to different categories. So headache was listed disease and disorders for which acupuncture therapy has been proved through control study to be an effective treatment. So that's a high level of the recognition for acupuncture in the medical field. If we look at the PubMed and find the acupuncture in the treatment of migraine and those related article, total about 664 articles, and especially after 2005, the new century, and especially in recent 10 years, the article has significantly increased. So 2020 to now, so now is June 2025. So it has not, it's already have 232 articles. So it's the most distinguished article about migraine headaches in 2004. This British scholar, Andrew Vickers, and he used to work in New York, the Memorial Sloan Kettering Cancer Center. And he's one of the important articles talk about the systemic review of acupuncture for low back pain. So in this article, and whatever in the future, you have more clinical trials, either in favor or not favor to acupuncture treatment for low back pain, need 50 more. So it's very solid evidence of acupuncture in treating low back pain. But today I'll talk about the migraine headaches. So he used some kind of trial and also relate to the sociology or those kind of data, the quality of the life. So that's for acupuncture treatment. And the patient had a headache, and acupuncture treatment, they will experience 22 fewer days with headaches and 15% less medication, and make 25% fewer visits to their doctor, and took 15% fewer days off, 6 days off from work than a control group. So this at that time was a very important. In 2012, and started as an article about acupuncture for migraine prophylaxis. This is for the prevention. So it indicates many articles talk about acupuncture treatment was successful for migraine attack, episodic attack. But this started with talking about the prevention. Prevent the new episode of migraine. The Professor Liang Fanrong, in Chengdu University of Traditional Chinese Medicine, and his team until now has very active in the evidence-based the research. In 2016, that's very important white paper from Cochrane Library. So Cochrane Library is the headquarters of the data center of evidence medicine. It's the white paper has a review for acupuncture for the prevention of episodic migraine. So the conclusion is positive. Acupuncture can be considered a treatment option for patients willing to undergo this treatment. As you know, not so many indications has been proved either clinically effective, think also clinically effective, like a Bell's palsy, but in the systemic review or meta-analysis, and based on the very solid evidence-based medicine study, we cannot get positive feedback or the conclusion. But migraine headache is the one, and not only to treat the migraine, but also for prevention. And then the same in the Chengdu University of TCMT, and they published an article, The Long-Term Effect of Acupuncture for Migraine Prophylaxis in the JAMA International Medicine. So it's very high influential factors. So that's the very solid conclusion. You see, this is the waiting list. This is sham acupuncture. That's the true acupuncture. So in 24 weeks, and we'll see significant decrease. That's the long term. In the 1 to 4 weeks, 5 to 8 weeks, and then flat, almost 17 to 20, little bit going up in 21, 24 weeks, still lower than in 1 to 4 weeks. That's the baseline before the treatment, so it's very significant. In 2020, also another systemic review, and I found the quality of evidence. So, and also could be the superior to Western medicine. In 2020, and also another article talk about the migraine prophylaxis. The team in Chengdu University of TCM and still working on this topic and a very in-depth study. In 2024, they published a new article and acupuncture for migraine, a systemic review and a meta-regression of randomized control trials. So they find the result, the study recommended 16 sessions of acupuncture with a frequency of 3 sessions a week and treatment duration of 1.5 to 2 months. So this is actually will be very helpful for case management, and you can tell the patient that's the solid data show how often you should come. So in the Western society, probably 3 sessions a week is impossible, but at least you would try to 2 sessions a week, right? So that's the solid data. And so we always say translational medicine from this kind of data and from bench to bed, and also as I say, it's from the evidence to practice, and that's the importance we had to share with the patients. So we talk about the clinical protocols of personal experience. The migraine headaches, I think, also could be different kind of factors, but the most important exopathic invasion is the wind, and interior disarrangement, mostly related to the liver, and also bladder-stasis, wind fine or bladder-stasis. They're more like associated with the episodes of the migraines. In Lingsu, miraculous pivot already mentioned what kind of the channel will be related. So it's a mostly gallbladder channel and the urinary bladder channel points will be more important. And those in a different kind of classics mentioned those kind of points. So that's, I think I will try to skip this. But something very interesting, the treatment, they has to, ask the patient to cooperate on doing something, or not only the acupuncture and doing the moxibustion. So is the patient inhale, exhale 3 times, and then those kind of coordinate, and it will improve the therapeutic effect. But that's very interesting, but because of time, I'll not elaborate to details. This is the standard of the from Chinese medicine, Chinese acupuncture and moxibustion society, the evidence-based clinical practice guideline that including during the episode, it could be the breathing technique, and it could be acupuncture or electroacupuncture and pyroacupuncture. But the pyroacupuncture is a weak recommendation. The breathing technique and the acupuncture, that's a strong recommendation. And during the interval time, and mainly with the Shaoyang channel, and they use combination of comprehensive plan, acupuncture, scalp acupuncture, that means body acupuncture, scalp acupuncture, electroacupuncture, warming needles, and the breathing technique, the combination. That's a strong recommendation. And also in 2021, the Neurological Society, Neurology Society, also they organized a discussion for the non-pharmacological pain management for migraine. So that's also the similar results. So that's information. That's the during episode of filiform needles, or during episode of different kind of Marxer scalp acupuncture, breathing technique, pyroacupuncture, and ear points. During the intervals, and so that's more important today. We're talking about the migraine prophylaxis. So according to the experts' consensus, they were including those kind of types, could be liver yang rising, turbid phlegm, or blood stasis, and in some cases maybe insufficient qi and blood. So the main points including Du20, GB20, GB8, Taiyang, and distal use Sanjiao 5 or GB34. This is the one protocol, and I mentioned could be more concise, and this the clear and disperse the liver and the gallbladder, and actively channel relief pain. Use the Sanjiao 23 and joint puncture to GB8. Sanjiao 23 to GB8. And also the foot will be applying GB41 and GB20. So those method is very similar with the my mental mentioned points, and the lineage of the Fang's acupuncture style. It was the inherited intangible cultural heritage list of Shanghai municipal government, and that's my mentor, Dr. Fang, and he tried to use posterior Taiyang and similar, and going to the lateral, and similar with this method. Because we go to, that's from the Sanjiao 23, but Dr. Fang tried to use the posterior Taiyang, going this direction, horizontally insertion. And the GB41 also is very important. And he discovered when a patient had an episode, it will be very tender on the same side, GB41. And at this point, it's between the fourth, fifth metatarsal bone, but the lateral to the ligament. So we should be careful with the needle direction. The needle is supposed to be between two bones. If you insert a needle, insert the skin, and directly touch the bone, it's not right place. So that's the experience, and those kind of important points, GB20, as he also mentioned. And he also finds some C3, there's C2, there's C3. Spinal process has some kind of nodule. So that would be very helpful, especially for the migraine, frequently happened, and for prevention, that's also will be very important. So in 2021, I published the article From Evidence to Practice, as this the meaning, the importance of developing guidelines for clinical practice in migraine prophylaxis with acupuncture. So I think it's very important during the intervals, how we can use acupuncture treatment to intervene and prevent the new episode of the migraine attack. So those are all the considerations. The body constitutions, as my observation, many migraine headaches has the qi stagnation, liver qi stagnation. But according to the different articles, because there are total 9 body constitutions, they find not only the qi stagnation type, but also has the blood stasis type and the yin deficiency. So corresponding to those body constitution, and we can set up the point to dealing with this problem. How can I know what the body constitution I belong to? They have I didn't put this barcode, sorry. You can Google. The Chinese version, and it has the you can directly go into the questionnaires, and to the end, you will get immediate score what the body constitution you will be. And in English version, unfortunately, you had to print out the form. You check out each question, and then sum up the scores, and then you will find what body constitution you are. Unfortunately, I tried many websites. I couldn't find in English version, only in Chinese version. They have an app can directly tell you the body constitution after you complete the survey. Single analysis also very important, mostly if related to Zangfu organ and is a liver-related system, liver qi stagnation, or related to the Shaoyang channel. So that's a soothing the Shaoyang. So GB20 always number 1 point to taking care of this. And the other thing could be blood stasis or the phlegm accumulation. And we should be careful about the needle acupoint selection. So fewer points will be better. And also based on the situation, usually we use the reducing methods. I mean, this other modality as described in the guidelines. So the treatment plan, how many visits is better, and how long the duration now has solid evidence. Those are the points I think can be added, and with those kind of different syndrome differentiations. It's very important for the migraine headache patient. They have to adjust the work routine and avoiding like night shifts, be relaxed, and also doing the meditation and like a qigong, tai chi, and also be careful with the food. Of course, avoiding the smoking, no smoking, no alcoholic, and less chocolate, as we say the trigger. Unfortunately, less going to Chinese restaurant for delicious food, or you can do at home and without SG, MSG, and without MSG. So that's the plan. We share the information with the migraine prophylaxis. It's very, very important. They have a solid evidence there, and the practitioner should share those with the patients. And not only during the episode you come for treatment, and in advance, and then you should continue to acupuncture treatment to prevent the new episode. So I think the time's up. So thank you very much, Dr. Xu, everyone.
Okay, thank you, Professor Chen. Thank you for sharing your research, your knowledge, and experience. Thank you very much. Thanks. Good afternoon, everyone. Now we continue our online lecture in English. So first, let me welcome speaker, Dr. Yuan Yuan. Dr. Yuan Yuan got her PhD in Chinese medicine, fields of specialization, gynecology of Chinese medicine, China Academy of Chinese Medical Sciences. So Dr. Yuan Yuan, her topic is eating wisely, culture of food therapy, and life nurturing for women and beauty care.
Hi everyone, I am Yuan. So glad that it's the 5th year I'm here to get together with you and discuss the information about food therapy in traditional Chinese medicine. My speech title is Eating Wisely, Culture of Food Therapy and Life Nurturing for Women and Beauty Care. The talk has 3 parts. Part 1 is overview of food therapy and life nurturing. I will introduce the concept, effect, and principle of food therapy and life nurturing. In the second part, you will know some specific diet recommendations in different stages of women's life, such as menstruation, pregnant, and menopause. The third part is about food therapy and life nurturing for beauty care. Now let's begin. Part 1 is the overview of food therapy and life nurturing. First of all, we should know some concepts. Life nurturing is to use traditional way to promote health, prevent disease, and enhance longevity. It's also called health preservation. The method contain qigong, meditation, etc. Food therapy is one of the life nurturing methods. It's to use the characteristics of food to regulate body physical functions under traditional Chinese medicine guidance. In traditional Chinese medicine, food is more than provide us energy and nutrient. More important, it can correct body disharmony by using its own character. In this level, food has the medical function. We call it homology of medicine and food. There are 3 food effects in traditional Chinese medicine. The first one is to replenish qi and blood, to tonify viscera and bowels. That means to increase the healthy element in our body. For example, tremella can tonify qi and engender food. Chinese yang can notify the spleen and replenish qi. The second one is to treat excess by purgation and eliminating the pathogenic factors. That means to drive the unhealthy element out of body. The examples are like or can promote digestion, remove food retention, and coexceed can induce diuresis to alleviate edema. The third function is to modulate yin and yang, such as mutton can warm and tonify yang. Lily balms can enrich yin. There are 4 ways to benefit in food therapy. The first one is to warm tonification in the lower left corner. It means to use food to increase yang in body and warm body. Dried longyan and Chinese date belong to warm tonification food. In the upper right corner, we see cool tonification. It means to use food to increase yin and decrease yang fire in body and make body feel cool and calm. Bitter gourd and watermelon belong to this kind. If the food is not warm nor cool, it belongs to neutral supplementation, such as honey and yang. This kind of food always can tonify qi and blood. If the disharmony is too obvious, we can use the method of drastic supplementation. It's like use mutton with spice to warm yang qi, use soft-shell turtle to tonify yin. Well, we know different foods have different characteristics, and how to distinguish them. We can differentiate them from 5 flavors, 4 qi, and meridian entrance. 5 flavors are 5 tastes of food or drugs. They represent the basic actions acting on our body of the food or drugs. The first flavor is sourness. Smoked plum, using for plum syrup, lemon and whole are sour taste. The function of sour food is astringent. It could arrest discharges due to insecure healthy qi and declined vascular function, which means it can help to decrease unnecessary sweating, relieve hyperuresis, and mild diarrhea. Bitter gourd, salt leaf, leaf mustard are all have bitter taste. They could clear heat, purge fire, and detoxifying. Try to use them when you have acne, yellow urine, or feel annoyed. It's obvious that maltose, Chinese date, pumpkin are sweet. In traditional Chinese medicine, sweetness can tonify healthy qi and relax tension. So when someone feels tired or has mild abdominal pain, if we know there is no organic disease, we can use sweet food to relieve this discomfort. Pungency food, or spicy food, can induce interior disease moving out of exterior, regulate and move qi. We can use them to treat common cold. Green Chinese onion, garlic, and ginger belong to this kind. Salty food can help to soften hardness and dissipate bites, relax the bowels. It contains nori, seaweed, and turtle shell. 4 qi means 4 basic properties of food or drugs: cold, hot, warmth, and coolness. The cool and warm here are not represent the temperature. If we see a food is cold or cool, it means the food can clear heat, purge fire, and detoxify in traditional Chinese medicine. The food can make us feel cool and calm. The representative cold food contains watermelon and mung bean. Cool food contains duck egg and tofu. Also, warm and hot food can dissipate cold and assist yang to make us feel warm. Warm food contains chicken and green Chinese onion. Chili and cinnamon are both hot food. The next classification method is meridian entrance, orientation of food or medicine, action according to the meridian on which the therapeutic action is manifested. There are 2 ways to classify the food into meridian. One is according to flavor. Sour food firstly acts on liver meridian. Bitter food firstly acts on heart meridian. Sweet food mainly acts on spleen meridian. Long meridian is the target of spicy food, and salty food mainly acts on kidney meridian. Another one is according to the food function. For example, watermelon and white radish can engender stomach fluid. Ginger and cinnamon can enhance appetite. They all go into stomach meridian. Goat qi and animal liver can tonify the liver blood to improve eyesight. leaf mustard, and chrysanthemum. Both can clear liver fire to improve eyesight. These 4 foods all go into liver meridian. Now we know the food characteristics, how to eat food properly. The first principle is to harmonize 5 flavors. It means we'd better not have a partiality for a particular kind of food. The Chinese code says we should take different cereal as nutrients, take different foods as assistance, take different meat as beneficial ingredient, take different vegetables as supplements to get balanced nutrition. The second principle is eating regularly and moderately. Don't starve yourself or eat too full. Then we must pay attention to diet hygiene to avoid foodborne disease. The next is we'd better eat proper food according to the right location, timing, and fit our body constitution. It's like if someone is lack of yin and easy to get flush or thirsty, then he'd better not to eat too much spicy food. After we knew the basic information about food therapy, now we can move to the second part. I will share some specific diet recommendations in different stages of women's life. Firstly, we should know the physiological feature in different stages of women. Now we see the menstrual physiology in traditional Chinese medicine. There are 4 conditions in menstruation. In pre-menstrual period, both yin and yang are exuberant. Women are easy to be cross. In menstruation, extreme yang began to converge to yin. Yin grows in post-menstrual period, and in ovulatory period, yang starts to grow from extreme yin. When women get pregnant, yin and blood are used to notify breast to prepare milk production and pour downward to nourish the fetus. These changes may lead to several conditions, such as keeping essential qi in uterus will result in menorrhea. Deficiency of qi and blood will lead to fatigue and mild dizziness. Stomach qi failing to bear downward can cause nausea and vomit. Yin-yang qi and blood disharmony will cause further metabolic disorder, such as thyroid dysfunction, carbohydrate or lipid metabolism disorder. There are 2 conditions after giving birth. Easy to have deficiency pattern will cause fatigue, fear of cold or heat, profuse sweating or spontaneous sweating. Easy to have blood stasis pattern will lead to abdominal pain, lochia, and depressive thoughts. When women step in menopause stage, kidney yin and kidney yang are both deficient. It will cause a bunch of symptoms such as anxiety, headache, memory loss, etc. Now, let's look at the specific diet recommendations for women. For menstruation, in pre-menstrual period, we can take rose or chrysanthemum tea to release irritable mood and to use danshan tea to prevent acne. If someone has painful menstruation, we can use cinnamon and ginger tea or honey tea or mutton soup with angelica and ginger to relieve the pain. If you have mild diarrhea during the menstruation, you can take white hyacinth bean porridge with young and stewed pork tripe with lotus seed to strong your spleen and stomach. It's easy to feel fatigue in post-menstrual period because of qi deficiency. We can take yam porridge with huang qi or chicken soup with wuzhi maotao to nourish qi. Ovulatory period is the most important time for getting pregnant. The key point is to active blood move to facilitate the ovulation. Stewed walnut with yellow rice wine and chicken soup with dangsheng, danggui, and xiangfu both have this efficacy. Then we can see the suggestions for pregnant women from early middle time to late pregnancy. There are several routine suggestions for women in the early pregnancy. The most important one is folic acid. Lack of folic acid may lead to neural tube defects. Folic acid is abundant in green vegetables, fruit, and animal liver, but it's not enough just to rely on natural food. So women should take folic acid supplement 400 microgram per day at least 3 months before pregnant. Another important element is iron. Lack of iron may lead to pregnant birth, premature birth, low birth weight of newborn, and pregnant women may not gain enough weight. Iron is abundant in red meat, animal liver, and animal blood. Vitamin C facilitates iron absorption. Fried pork liver with green pepper and fried duck blood with leek are good choices to replenish iron. Iodine is also very important for pregnant women. It's necessary to thyroid function. Iodine is iodized salt. It's not enough for pregnant women, especially in iodine deficient area. So pregnant women should take at least 1 meal with rich iodination food per week. We can choose mussel, kelp, and seaweed. We know that women in early pregnant stage are easy to have nausea and vomiting. She can take ginger rice porridge for spleen insufficiency pattern, or take dried orange pale ginger tea for liver qi, invading the stomach pattern. Women can replenish DHA after mid-pregnancy from natural food. DHA is good for fetal brain and retina development. It's abundant in deep-sea fish like codfish and hairtail. It's better to eat deep-sea fish meal 2 to 3 times per week. Another important one is calcium. Lack of calcium is bad for blood pressure control in pregnant women and may lead to fetal retics and fetal salt score. Pregnant women should take at least 500 milliliter milk per day. Constipation is a common symptom occurs in pregnant women. If someone has normal feces but needs much straining to evacuate, she could take sweet potato porridge or honey milk. Dry feces is always related to iron deficiency. We can use pine nut sugar and hemp seed porridge to relieve. After giving birth, there is a 42-day stage. It can be divided into 3 parts. The first week focus on expelling. The importance of second week is regulating to harmony. From the third week to the end of this period, we focus on tonifying. In the first week, facilitating the exclusion of lochia and uteral contraction is important. And there is no need to promote milk production through diet. If so, it may lead to mammary gland blockage. Lean pork soup with angelica and ginger and millet congee with brown sugar are suitable. In the second week, we may eat some food to promote milk production, but still need to avoid a high-fat diet. We can take crucian and bean curd soup and black bean sesame porridge to regulate the liver and supplement the kidney. From the third week, we can tonify qi and replenish blood, which lost labor, milk secretion, and sweatness. New mom may take hen soup with red juju and yam, and pork tortoise soup with tontao to promote milk production. The last part is about food suggestion for menopausal women. Since kidney yin and kidney yang deficiency is the main cause of the series of symptoms, we should enrich the kidney yin and warm the kidney yang. If someone has hot flashes or vaginal dryness, she could take steamed soft shell turtle with gochi and duck soup with mock bean and winter warm summer herb. If you are upset about headache, insomnia, or memory loss, you can try ginkgo tremella sweet soup and stewed pigeons with tianma and seed of white juju. Anxiety and depression can be relieved by ganmai Chinese state congee, gochi, chrysanthemum tea, and rose crisp. Women with osteoporosis can take stewed add milk and vitamin D. In the third part, we can focus on food therapy and life nurturing for beauty care. The beauty of women comes from health. It is manifested in a well-proportioned figure, smooth skin, and healthy hair. In traditional Chinese medicine, by using natural ingredients, we can regulate our body functions and achieve these goals. Let's start with maintaining a shapely figure. The first principle is to have balanced diet. This means including grains, fruits, meats, and vegetables in our meals and avoiding picky eating habits. The second principle is to control our calorie intake. We should adjust our diet based on our body type and activity level to prevent overeating high-calorie foods. The third principle is to strengthen the spleen and remove dampness. In traditional Chinese medicine, the spleen is responsible for transforming and transporting nutrients. A weak spleen can lead to dampness and obesity. Foods like red beans, seed, and yam can help with this. Now we can look at some specific recipes. For example, we can take lotus leaf and hot tea. This tea helps remove dampness and reduce fat. Another recipe is winter melon and pork rib soup. Winter melon helps drain water and reduce swelling, while pork ribs replenish energy. And for breakfast, we can have oatmeal and milk porridge to provide protein and control blood sugar. Next, let's talk about beauty and skin health. The first principle is to nourish blood and moisturize. In traditional Chinese medicine, blood is the foundation of skin. Nourishing blood can moisturize the skin and make it smooth. Foods like red dates, 龙眼, are beneficial. The second principle is to clear heat and remove dampness. Damp heat can cause oily skin and acne. Foods like mung bean, bitter melon, and winter melon can help. The third principle is to consume antioxidant. Food rich in vitamin C and vitamin E can delay the skin aging. Here are some recipes for beauty and skin health. We can make red date and 龙眼 tea to replenish energy and nourish blood. Another recipe is mung bean and bitter melon soup to clear heat and remove dampness. For a simple drink, we can have honey and lemon water. Honey moisturizes, and lemon is rich in vitamin C. It helps whiten the skin. If you are troubled by hair loss, you can try 3 black porridge, which is made by black soybean, black sesame, and black rice, or simply take sesame walnut candy to notify incense and blood. Of course, diet therapy is just one part of the equation. We also need to pay attention to our lifestyle. Firstly, maintain a regular schedule. Go to bed early and rise early to ensure adequate sleep, which helps the body repair itself. Secondly, engage in moderate exercise. Activities like Tai Chi, 八段锦, yoga, and jogging can promote blood circulation, enhance physical fitness, and help maintain a good figure. Third, manage your emotions. Maintain a positive mindset and avoid excessive anxiety can affect endocrine function and good for your body shape and skin. In conclusion, traditional Chinese medicine diet therapy is an effective way for women to maintain a healthy and shapely figure and achieve beauty. Well, this is what I want to share with you. Thank you for listening. Hi everyone, I am
Thank you for Dr. Yuan Yuan's sharing a video. Elizabeth, are you there? Elizabeth.
I'm here. Hello. Can you hear me?
Okay. Now, now I introduce the next speaker, Elizabeth Yao. She received her TCM training in China, Australia, and Hong Kong. So her topic today is the role of Chinese medicine in treating female infertility. So Elizabeth, you can start your speech, okay?
Okay, 1 second. Can you all see like the PowerPoint here?
Yes.
Yes, you can see it from here, right? Okay, so let's start the presentation. Today I'll talk about the role of Chinese medicine in treating female infertility. Thank you for the introduction. I'm Elizabeth Yao. I studied at HKU and I also got my placement in Shanghai. I'm also a registered sport nutritionist in the UK, but in Hong Kong mainly I do Chinese medicine. Let's talk about today content. We'll talk about what Chinese medicine in, also infertility rate and also treatment in Chinese medicine and how Chinese medicine can cooperate with different treatment, let's say the Western treatment. First of all, talk about the infertility rate. Infertility rate is rising globally. In around 1 in 6, they experience infertility, highlighting the urgent need for accessible fertility care. So for TCM means traditional Chinese medicine, we offer a holistic approach to support fertility. We integrate body, mind, and spirit for reproductive health. Our goal is to empower women with evidence-based and natural options. So why do we talk about infertility that often this day? Because comparatively, before, we didn't have that much of issue, but right now we have the delayed parenthood. The average maternal age now is 31, vs 26, 20 years ago. So the age is rising. Our fertility declines from the mid-20 to mid-30. Our egg quality is not as good as when we were younger. Also, we have the unhealthy diet. Modern diet are high in processed food. Cold or raw food are not good in our theory because it impairs qi and blood flow. Lifestyle and stress are one of the main concerns this day as well. Office job or 24/7 connectivity. It will increase the chronic stress and also reduce physical activity that could probably influence your menstrual cycle. So how TCM can work with that? We treat it holistically. TCM treats infertility by balancing our whole body. Next to this table, we have yin-yang theory and 5-element theory. Those are two very important theory in Chinese medicine. It talk about how our body can build a system of qi, blood, yin-yang. With the harmony, we can be more healthy. So if there's any imbalance, it could cause infertility for our topic. So how do we deal with that? We have acupuncture, we have herbal medicine, diet, and lifestyle. The registered Chinese medicine practitioner could let you know what food are good for you and what kind of lifestyle change you need to do. It's usually tailored to pattern because we see everyone differently. We are personalized via your pulse, tongues, and also your symptoms. So at the end, we want to boost fertility, reduce stress, and enhance vitality. There are different kind of researches. They are on PubMed or other online articles. So I just put one here. It's quite easy to search online, but this is the summary. So this study is actually compare infertile women into two groups. And based on the research, the result seeing that women using TCM therapy has a higher chance of getting pregnant. So it comes to a conclusion that TCM therapy might help to increase the pregnancy in infertile women. There are different concepts. It is very important for fertility. The most important one here, I put it, is preventing diseases. Because when you need to conceive naturally, there are a period of time. So by preventing the infertile situation from happening, there are a few things that you can do with Chinese medicine. If you come to a Chinese medicine doctor, you don't need to necessarily have some diseases or illnesses, but you just want a better body. So for this part, you just want to prepare your body for natural conceive. Here, prevention is better than cure. So Chinese medicine can provide this kind of treatment for sub-health status or illnesses due to the imbalance of the body. How do we do it? By regulating yin-yang, replenish the deficiencies, reduce the excess. So the method of regulation, like our treatment, herbal medicine and acupuncture are the two main concepts that I'll carry on later in this presentation. But let's talk about how to prevent from having infertility. women, we mention a lot about qi and blood. Qi and blood are very important, and they are like the foundation of women's health. They nourish our uterus, ovary, and the entire body. So when your qi and blood are abundant, your menstruation is smooth, fertility is high, even your skin will look better. Some signs of qi and blood deficiency over here. You might have easily fatigue, prone to cold. You have irregular menstruation. You have cold hand and feet. So these are like the small signs. Some people, they might tend to ignore it. But eventually, it would lead to light menstrual flow, infertility, insufficient breast milk if you're going to have breastfeeding, or even like at the end, early menopause. Talk about like the 3 key organs for women's health and also for fertility. Liver is very important. When it comes to fertility, stress is one of the main issues this day. A lot of people are stressful about work and also like about having baby. Liver is one of the main organs to regulate emotion and menstruation. And second, spleen. Spleen helps to produce your blood and qi, essential for uterus and pregnancy. If you have weak spleen qi, your menstrual flow might not be as good. Your baby development might be poor. So at the end, kidney is one of the things that we have to focus as it stores the exit. It determines the fertility and menopause. If you have kidney deficiency, infertility might come, or even like early menopause. So now talk about the causes and patterns for infertility. Causes of infertility in the Western medicine first, and then later we'll talk about in Chinese medicine. So Western medicine, we pinpoint specific infertility causes. So there are different names of diseases. I just name a few here. For female factors, PCOS is one of the main issues that we are facing this day. PCOS is the polycystic ovary syndrome. They might have irregular ovulation, endometriosis, or some tube blockage. Men is like one of the focus when it comes to infertility. But for this topic, we mainly focus on women. But for men, we often have to look at their sperm, how is their count or the mortality. Some of the men, they have hormone imbalance as well. So we can do herbal medicine to help to boost their kidney function or remove some fire. Unexplained infertility here, it comes to like 15 to 30% is quite a big number. It's from the research before. There's no clear cause. For this kind of people, they usually come to seek for help from Chinese medicine because there's like no explanation for their infertility. And the last one, lifestyle. Obesity, smoking, excessive alcohol, or exposure to toxin. Definitely, like your health wouldn't be good if you're exposing to that many unhealthy lifestyle and habit. So for this line, I talk about in Chinese medicine, what are the causes? Physical and structural causes align with Western medicine diagnosis. But of course, like for this part, we need some help from the evaluation over there. Like we have to see the blood test, ultrasound to fully identify the real diagnosis with the disease's name. But for TCM, we have the functional causes. We look at the age, we look at their diet, we look at exercise level, stress level, because we see infertility as the energy disharmony, imbalance in the body. There are 4 common TCM patterns I list here. And for the next night, I will just talk about these 4 completely. So how to identify these 4? If you see a Chinese medicine practitioner, they feel your pulse, they see your tongue, they ask about your symptoms, and then they can analyze and diagnose for you. Common TCM patterns, I list 4 here. There are much more in the real clinical practice, and sometimes they'll be like mix and match, but here are the 4 common types. The first one is kidney yin deficiency. Some symptoms, you might see it over here. They have irregular period, insomnia, hot flushes, night sweat. The yin is not enough, like especially during the nighttime. So common causes, ages, overwork, long-term stress, sometimes could be genetics as well. So this will be like the effect that will happen for equality thin uterine lining. If your uterine lining is usually like lower than 7 mm, it's quite difficult for you to conceive naturally as well. Liver qi stagnation. Liver qi stagnation is the second one. We see quite often with PMS, premenstrual symptoms. 1 week before your period, you feel very emotional, you have back pain, and you have irregular or painful period as well. Liver is very related to stress, so the common causes will be related to stress as well. It will affect your hormone. The third one is blood status. It's also called like blood stagnation. You will have dark or clotted period. So sometimes like people think if you have brown or like dark red color of your blood is normal, but it could be a sign of your blood stagnation. If you often see the clot over there and also like bruises all around your body, it wouldn't be a good sign. So this is because of the poor circulation or some past surgery causing blocked implantation or poor uterine blood flow. And the last one, cold in the uterus. This one is quite common in Hong Kong as well. People like to drink a lot of cold drink. They are in the cold environment. AC is everywhere. They see that like they have cold hand and feet, low energy level, always feel fatigue. They could cause to the lower blood flow, or even like the embryo growth is quite poor as well. So the treatment over there is to help them to balance it all. Like with this 4 imbalance pattern, we do the opposite thing. These are the treatment for TCM. So now come to the treatment. How to do our treatment? We need to do it individualized. We see people or like person differently, like everyone is special. So we look at 3 factors: the patient body type, age, gender. When gender, we talk about like men or women infertility. Season, different weather or humidity can cause to different body constitution as well. Like these days raining outside, it's very humid outside. So probably your body will have more damp than over the time where there's no humidity in the weather. For the local, like Hong Kong is quite different than the UK or Canada as well. So we have to adjust your medicine in different way. This is our main therapy when it comes to fertility. It's usually like very tailor-made to your own body type, because when we want to boost fertility, we often have to look at your gut health, your hormone level, your period, and even your stress and sleep. So everyone is different. Like you can't give your own medicine to your friend or like your family member. For herbal medicine, we use natural herb prescribed to rebalance your body's energy, support your fertility, boosting some organ that you need to boost or remove some fire or damp in your body. So acupuncture, fine needle are put to a specific point. There are 12 meridian over your body. So depending on which organ you're more imbalanced, we have to replenish it or like remove the excess. Cupping here mainly for the relaxation. If people, they are so stressed and cause to the physical stress as well, cupping is a good way to ease your muscle tension. Cupping can also have the detoxification function as well. So this one, I particularly talk about how herbal medicine can help with fertility. On the right side, I show a paper over here, but I didn't go deep into it because I just put like the potential benefit and function on the left side. There are a lot of research, evidence-based research all over the internet these days. It's a very good trend that we are using a lot of studies and analysis to see like how this traditional method can help with us in a more scientific way. So why it helps for herbal medicine? Because like I said before, it is like highly individualized. Each formula is tailored to your unique body. It works to restore your internal balance. Potential benefit and function are here. Definitely, it can help to regulate your menstrual cycle, improve your egg quality, and reduce inflammation in your body. We do it by nourishing the yin and blood for better egg and uterine health. Liver qi, if you have like high stress level, we have to regulate your liver qi as well, clear your blood stagnation, and also warm your kidney yang to enhance the embryo development, especially for those type they have cold uterus. And at the end, you can boost your energy and overall vitality. Some people, they have issue with fatigue, they have weak blood and qi. Herbal medicine can help with that too. So this slide, I talk about acupuncture for fertility. Also, like here, I list the example of the research paper. Why acupuncture help? Particularly, we like to boost the uterine blood flow. We put quite a lot of needle over the lower abdominal area. The potential benefit and function, boost the blood flow to support egg development, regulate hormone level. We have different meridian like in the body. Liver meridian is one of the meridian we put quite a lot. When it comes to some stopped or delayed period, acupuncture helps a lot as well. So the other thing is thicken the endometrial lining, the uterus lining as well for better implantation. For the organ level, if we put over the kidney meridian, spleen meridian, it helps to nourish the reproductive axis, like the 3 key organs for fertility. This is two of them. So it can calm the liver meridian is another one. So this comes to the 3 key organs. So at the end, it can also enhance the blood flow for uterus and ovary. This one, I talk about menstrual cycle regulation. So why do I have to mention this one, menstrual cycle regulation? Like we are talking about fertility, right? We don't like to see period coming. But for TCM, we emphasize preventing diseases before it arises. So we typically want to dedicate 3 to 6 months for regulating your hormone level before trying to conceive naturally to make sure that your body is in the most receptive state for healthy pregnancy. So 3 to 6 months are a good number, depending on your situation though, like if you, for your age, for your past medical history, to see if you have miscarriage before, this number could be different. So why this step is very important before the natural conception? It can help you to balance your yin-yang, qi blood, support your hormonal regulation, strengthen your organ system, promote ovulation. This one especially for people having PCOS, they have to make sure their ovulation day is quite similar during those days. And restore optimal reproductive function as well. So I talk about what are the healthy menstrual cycle here. For cycle, particularly 28 days is the most ideal one, but in the clinical practice, 21 to 35 days also normal if it's regular. But we like to see it once in a month, 28 to 32 days a good number. The duration, 5 to 7 days, smooth flow without any clog is the best. Color, bright red. The flow is this number. No major discomfort. Sometimes you might feel on the first 2 days, you might feel a bit of bloating, discomfort. If you don't need painkiller, it's all right. But if you start to have some severe pain that you definitely need painkiller every cycle, it's not a good sign. If you have dizziness, headache, accompanied with back pain, it's not good as well. Ovulation, it usually come around day 14 if your cycle is 28, half of it. If pregnancy doesn't happen, the uterine lining will shift afterward, you have period afterward. So how do I teach my patient how to look at their ovulation or period, how to track them if they are preparing for pregnancy, if they don't want to buy the ovulation test paper, because sometimes 6 months is quite a long period. Just by doing some basal body temperature, it can help us to kind of analyze like during which day are the ovulation period. This method is especially good for some young lady experiencing PCOS because their ovulation period is quite irregular every month. For BBT, you measure like every morning, so you would know like how your temperature is growing. Usually, like you can see, this one is the low temperature one when you have period. After ovulation, your temperature will rise a little bit, 0 to 2 to 0 to 6. But some people, like, they may have it differently, so it depends on the individual. It's 70% accuracy. Like I said, like for PCOS patients, sometimes like they might not have it like so obvious. For pregnancy indication, this is not like very accurate as well. Like the most accurate is to do a urine test or like blood test. But for this one, if you can see it for high BPT for a long term without seeing your blood going out, we could probably like see if you have pregnant during this day, but definitely go to do a blood test or like urea test. How do we know like what medicine we should give by knowing your BPT? Because we see acupuncture or herbal medicine regulation for 4 different phases. The first one here, menstrual phases, because you have the blood flow. We want to promote your blood circulation, clear stagnation. Menstrual phases, we usually have it 5 to 7 days. So depending on the individual, we can give different days of medicine for these phases. And afterward, we have the post-menstrual. Post-menstrual, because like your blood energy is going out during your period. So we definitely have to replenish your blood, especially for those people, they are more weak in blood energy. Nourish your kidney and blood is the main thing that we have to do. For the third stage, ovulation phases, we have to help to boost your yang and fertility. And the last one, premenstrual. Premenstrual, we talk about PMS symptom. We have to help to balance your liver qi. PMS, some people, it's regular, like every month they have it, like emotional back pain and stuff like that. So it's very depending on each individual. You have to give different helps. But this is like how we can help with regulating it. In integrative fertility care, for this line, talk about how TCM can work with Western medicine and why it is good to do it both at the same times. So from the researchers, we know that it can help to increase the pregnancy rate, reduce the miscarriage risk, and better patient center, because we treat everyone specifically, like everyone is different and special. So your patient like will feel more being taken care of in this situation. For Western medicine, they provide a more structural and hormonal insight because they have the blood test, they have the ultrasound. Some people, if they have to go through like IUI, IVF, they can do that for them as well. For TCM, we focus on the internal regulation. Like we know that if the patient, they have certain kind of structural or like physical imbalance or diseases, like endometriosis, PCOS, we have herbs, we have acupuncture method to deal with that too. But apart from the diseases, we can also improve their organ function, hormonal imbalance, stress management to let them have a better body for fertility. So this slide talk about like how to support IUI or IVF with Chinese medicine. Here they got a research paper talking about this as well. The result is positive. Some couple, they might choose to have the advanced reproductive technology due to some difficulty in conceiving naturally. There could be some miscarriage, unexplained infertility, or ages, like older ages, like senior. So TCM here, they plays a powerful role to support it by enhancing receptive throughout the whole process. They have like different phases for acupuncture and herbal medicine too. For pre-IVF or like pre-IUI, we help to nourish your kidney axis. regulate your menstrual cycle. Like this one, talk about the 3 to 6 months before doing this. And afterward, like we help to boost your blood flow to the uterus and ovary, particularly like using acupuncture, lower abdominal area to support endometrial thickness. Stress hormone, people are having stress issue. We do it over the liver, qi, or like spleen. This one improve your IVF success rate. Lifestyle change at the end, we talk about it. So previous slide, we mentioned how important kidney, spleen, and liver are, and also qi and blood for women's health. There are 5 things that we should focus on. Definitely, you need to have enough rest and sleep. Aim for 7 to 9 hours for quality sleep. Sleep before 11 p.m. will be great. 11 p.m. to 3 a.m. are the main hours for body organ clock to help liver and gallbladder meridian to rest. And second, gentle regular movement. Engage in exercise to help to promote your qi flow, relieve stress, but you have to avoid over-exercising because it can also deplete your kidney acid. Third, you have to keep your body warm because one of the main issues is cold uterus. Cold uterus could bring to infertility, so lower abdominal area and feet should be warm. You can soak your feet in a warm water or even put some ginger in it too, depending on your body constitution. Reduce stress. Chronic stress can help the liver qi stagnation. So let's try not to stress too much. Limit the exposure to toxin. Avoid smoking and too much alcohol. What are the food to prioritize for fertility? And this is the last line. So I'll go very quickly. You should eat aligned with your body constitution and fertility phases. For fertility phases, we talk about 3 to 6 months before fertility. Each week or like each phases, you need to have different food to support your body. Core TCM dietary principle, definitely warm food, cooked food, avoid cold or boiled food as those could make your qi and blood flowing not as good as before. Use food to tonify your blood, kidney accent, and qi. And these are the 4 patterns that I mentioned in the previous slide. And I want you to eat in line with your body constitution. For kidney yin deficiency, you need some food to boost your kidney yin. So these are the recommended food. Liver qi stagnation, that you need to drink something to help with your liver qi. But pay attention with that. Like if you're pregnant, I don't recommend you to do too much to smooth your liver qi or blood, especially like rose tea. That kind of tea could be quite dangerous if you drink too much when you're pregnant or when you're having like too much blood during menstruation, because it will boost your blood flow. So for blood stagnation, status, you should have food like that. And the end, like cold in the uterus, warming food will be very helpful for you. So this is the end of my presentation, and thank you.
Okay, we thank you, Elizabeth, give us the speech and her research and sharing. Okay, thank you again. And our next speaker is Monica Tang Wei Yang. Monica Tang is a registered Chinese medicine practitioner in Hong Kong, currently practicing in a private clinic. So, Elizabeth, can you stop sharing? Okay, good. Okay, so now we welcome Monica Tang. Her topic is traditional Chinese medicine in total pain management. So, Monica, go ahead.
Okay. Hello, everyone. Is it clear about my voice?
Yes, yes.
Okay. Let me. Okay. I will share my screen. Okay. Share screen. Okay, can you see my screen? Is it okay? Okay. Good morning, everyone. I'm Monica. I'm currently a registered Chinese medicine practitioner in Hong Kong, and I have my bachelor and master degree in CUHK. And today I would like to share the topic of how traditional medicine works in treating different daily pain syndrome. Yeah, I think about the total pain management is include two parts. One of them is an effective treatment for the particular disease, and the other half is the daily maintenance, how you have training and exercise to improve your body condition. Yeah, so I bet all of you have different kinds of pain. Some common pain syndrome include the shoulder, neck and shoulder part, and the other one, the lower back, the whole spinal problem, and the knee pain. Yeah, they are very commonly seen in clinic. Yeah. So basically, when you have to talk about different pain issue, you have to know more about your body structures. One of them is like your spine. Yeah, your spine connect your it have different connection point for your different muscle tissues inside your body, and how the muscle move is very much coordinated by the nervous system. The nervous system include the central nervous system and the peripheral nervous system, and then these are some basic anatomy of your body structure. So beside the muscle that you can see and you can touch, and inside your internal organ is also you have the muscle tissue that is also connected with different nerves. So they have their own movement, including like your bowel movement, your heart, how your heartbeat, and your lung helps you to breathe. And for our spine, yeah, it has different curve for the so this helps supporting sharing your whole body weight, the loading, and then you keep your body in a balanced position. And then it also, the most important part, it protect the nervous system, our spinal cord. So it passes through from your brain to different body parts. So you have to check on how are you having a good posture. So as you can see, the patient on the left, it is very commonly seen right now, because you can see the head is going forward and have a flat back, and even round. And when you are using computer, you always see that posture. You have to be aware of it. And the other one, the central one, the middle one, is the balanced upright posture, which is good. And then for the right one, yeah, you can see that like you have a one shoulder, some weak abdominal muscle, so that you moving your hip forward. It's a little bit sway back. So like, yeah, you can check daily. So for a good standing position, you can locate your ear, your shoulder joint, your hip joint, your knee joint, and your ankle joint in the same position. And then that's a good standing posture, 5 points in one line. And for your sitting, your head and shoulder should be in one line together. Then that would be a better posture. But usually if you can't keep a good posture for a very long time, because your muscle will get tired and you will somehow move into a not a very good position. For your posture, if you keep poor posture for a long time, you will trigger your muscular inactivity, and if also getting used more weight, put on more weight on you, and then you had a higher risk of diabetes, and some of them because of lack of movement, prolonged sitting time during your work. You have poor respiration, your heart, your lung function, and more poor blood circulation. And then you also feel more fatigue. And of course, pain is the main issue. And then during the day of time, you have to nowadays people use a lot of mobile phone. So when you are taking metro or taking buses, when you see people standing, you won't see them standing very straight in an upright position, but usually you will see that their head is bending forward. So like for your head, it's around 10 to 12 pounds, which is about around the weight of a bowling ball. So it's quite heavy, right? So like you have 7 cervical bone. So it helps supporting your head, the weight of your head. So if you are keeping upright position, the weight of the head can share off the whole body loading. But like if you keep bending forward into up to like 60 degrees, your head becomes 60 pounds. 60 pounds, which is very heavy, and you keep doing that position for like 3 hours, 4 hours when you are taking playing some video games, checking on Facebook, or watching some videos, movie, and then it will create great pressure to your neck, and then it damage the structure of it. So you can see that when your head is bending for too long, it will lose the curve, the cervical curve. You will become a very strict structure under the X-ray image. So like as you can see, is along the green line, it is a normal cervical curve, but in this X-ray you can see that it is going very straight along the red line. We often say that it's a ruler leg, like a straight like a ruler. So and yes, you can see in the middle of it, the nerve and the blood vessel coming out. So that's the pathway for how the blood going into your head, into different parts of your body. So if you have poor posture, you will create a poor blood circulation to your brain. So you usually can see that one of the symptoms is brain fog. What is brain fog? You feel that you are inside the mist and the fog, and you will feel more dizziness and headache. Sometimes you forgot things easier, and then you loss of concentration, and then like some of them may have some ear ring, or you can't hear things clearly, and your vision goes blur. That's some symptom of about brain fog. And then like pain issues, of course, like you have anterior head syndrome. Anterior head syndrome is caused by the muscular tension, the spasm. That's why it keeps pulling your neck into a very straight position, and you have some of them may have compression by the nerve impingement or compressed herniated disc. Yeah. How you can feel that? Like you feel your soreness around your shoulder, your arm, and then like some of them may feel the numbness, of your hand, compressing your different nerve. Okay, and then like for some more serious symptom, you may also feel your leg, lower limbs have you lost your balance. You like the symptom is called like stepping on the cotton. Yeah, you can't move well. You feel muscle fatigue at your lower back. Yeah, that's how your neck, the nerve system, is compressed by the disc, herniated disc. And then like for your lower back, as you can see, if you are standing, you have normal lower back curve, right? But like if you are sitting for so long, when you are in a sitting position, actually you lost the curve. Yeah, but it's okay if you are sitting for like a short period of time, like not. But like usually you won't do that. Like you will sit for like 8 to 10 hours. Some of that. So for my patients when they are working on their audit or when they are working on their paper, checking some clerical work. Yeah, they sit for a very long time. So yeah, it will cause the kyphosis, uneven pressure on the disc. Yeah, so this is the herniated disc. You can see it compressed your spinal cord and your peripheral nerve. Yeah, so in Chinese medicine, we solve two major problems. Yeah, in your body. One of them is the stagnation problem. It's like your congestion. It's like traffic congestion. Yeah, the qi is not going smooth inside your body, and the other part is the deficiency. Yeah, it's like you don't have enough nutrients inside your body. You have to put in more nutrients for the growth of your joint, the joint fluid, and different body parts. Yeah, so for in Chinese medicine, we have 4 diagnostic methods to determine the types of your disease. Yeah. So the first one is the inspection. Yeah, the inspection. You look at your facial, the color, and also look at your tongue. Yeah. Different tongue represent different issue inside your body. Okay. When you see some thick coating, yeah, it usually represent that you have poor water circulation. The water accumulate inside your body. Yeah, you have to remove the water dampness. And then if you see that the tip is very red in color, it means that you have a lot of fire inside your body. You have to remove the heat inside. And then the other 3, one is auscultation. It's like listening for the sound. Yeah, you depend to determine your type of body disease. And then the olfactory, the olfaction, you smell. Yeah, some breath. Yeah, very for your stool or for urine. Yeah, the best smell. It also represent that your body is have more fire or water dampness inside. And the other one is called inquiry. Yeah, we will ask for the person about the regularity, the severity, and other characteristics of their body symptoms. Yeah. Okay. And then for the palpation, yeah, we palpate the wrist pulse as well as other parts of the body, the abdomen or other parts, or we check on their joint movement, where is the trigger point, where is the we check on the pain point. Yeah, that's how. So after the diagnostic method, we can analyze the body constitution. Yeah, so with different body constitution, it usually we have different treatment plan for different types of pain. Yeah, we have different treatment like herbs, acupuncture, fire cupping, moxibustion, something like that. For herbs, we use different herbs in our prescription. But if you are like at home, you can use different food. Yeah. If you are in deficiency, you can choose some yin nourishing food and moistening food like papaya, which is good for your joint. Which you use the papaya to boil to make a soup. Together with 土茯苓. Yeah, something 牛大利. Okay, some snow fungus, some fig. These are some nourishing. Yeah, and for kidney tonifying, you use chestnuts, you use walnut, okay, and cashew, like something like that. And then for qi boosting, spleen strengthening, we use the Chinese yam, the huaishan, some chenpi, tangerine peel, lotus seed, something like that. For nourishing your heart and strengthening your kidney, which you use shangji, and then you put in as wet date or lotus seeds, lily bulb, to make the shangji nianzi, 蛋茶. Yeah, this is good for your body. The tendon movement. And for the liver protecting, you use the green papaya. That's good for the joint, 刘大利土茯苓, something like that. Yeah. Okay, and then we have acupuncture, moxibustion. Yeah, you influence the flow of qi to relieve pain and treat various disease. Yeah, so sometimes we are not only using the needles, we also accompany the treatment by moxibustion. And the fire cupping is also a very good way to help the relief pain. Yeah, we use the fire to use up all the oxygen inside the cup, and then we suck the cup on your body. Yeah, so. And sometimes we put on massage oil as well, so that we can glide over your muscle group. So the gliding cup, you will see that after the fire cupping, you will see some dark circle, and there's some skin reaction like that. Yeah. If you have very severe stagnation, you will see that it go very dark in color. And after the fire cupping, you will feel much more relief. Yeah. So, and also for daily training, I think the sessional exercise training is also very good for your health. You can search it online. You can do it every day in a very short period of time, like 15 minutes, 10 to 15 minutes. Then you will feel stretch your body and regulate your breathing, and then it helps relieve the pain. Yeah, and also for toner, we have different toner techniques. Yeah, so that which can help and have different function to relax your muscle and promote circulation. Some techniques like rolling, swinging, and maybe some rubbing. You put on body oil, and then you keep rubbing or pushing your tissues. You can warm your tissue. You can disperse the stagnation problem, and some friction technique like rubbing your tissue. Okay, and then like pinching and pressing. Yeah, you can stimulate the acupoint. You can relieve the pain. And also, you have shaking. We can relax the deep tissue and regulate the qi. Tapping, yeah, you can reduce the stiffness. And some joint mobilization, you can keep rotating your head, joint. This it can restore the joint function and release the adhesion. So I will share a few acupoints with you all, so that you can help yourself when you're at home. So like the acupoint inside your body is like the different is located in different meridians inside our body. You have 12 meridians in your body. When you are looking at this picture, you will see that the meridians is actually very similar to the metro line, the MTR. And then like the acupoint is same as the it is similar to the different station inside the in your metro railway system. So different station have different specials, some special thing about it. So the first one is the He Gu, the Li4. It is located on the hand between the thumb and the index finger, and this so that when you press this point, He Gu, you can have some pain relief the headaches, relieve neck and shoulder tension. It also helps to boost your immune system, and also have calming effect. It will reduce stress and anxiety. So you can keep pressing this for like 3 to 5 minutes. So this is good for and easier to find. It's located on the hand. It's good for the pain relief. And the other one is the Yao Tong Xue. It's on the back of the hand between the second and the third metacarpal bone and the fourth and the fifth metacarpal bone. You don't have to push it at the same time. You can push it one by one. Okay, you can press it one by one. So and when you press it, you can with a rapid relief for your muscle spasm. So when you press this point, you can also move your neck to the right, to the left. So it's a good way to relieve the cervical pain for your neck. And if you have pain at your lower back, you can remove your waist. Turn to the left and turn to the right. So it can help alleviating the radiating pain down to the neck, the leg, the sciatica nerve. It also stimulates the blood flow. It relieves the lower back pain. And the other one is the 内关. PC6. Okay, it's located on the inner forearm. It's around 3 finger width, 2寸, possible to the wrist. And then you can, when you flex your wrist, you can see 2 very prominent tendons. Okay, when you flex your wrist. Okay, it's located 3 finger, and then in the middle of the tendon. So when you press it, if you have some palpitation, if you don't have some chest pain and some nauseous, you can, some of them may have motion sickness, seasickness. Okay, this is good to alleviate the heart issue, relieve the pain, relieve the chest discomfort. Okay, and also if you have wrist and arm pain, some carpal tunnel syndrome, you can press this 内关. This is good because it's have the median nerve. It help to relax the carpal tunnel. You can help. Okay, and also 足三里 is on the lower leg. So 3寸 below the lower border of your kneecap, and the 1 finger width, lateral to the to your little toe, so that this is where 足三里 located. Okay, 足三里 is a very, very good, famous for boosting up your immune system, and it's good for the longevity Yeah, it's usually famous for that. It's a tone neck point. Yeah, and also it's also relieve the pain at your knee. Yeah, and also relieve the sciatic pain, and then reduce inflammation. Yeah, so that, and also it's good for your stomach as well because it is located at the stomach meridian. So like it helps relieve some symptoms like bloating, diarrhea, indigestion. And the other one is the 尾中穴. 尾中 is located at the back of the knee. Okay, it can relieve the lower back and the leg pain. Yeah, it's a primary point for the sciatica, the leg cramp. So it also improve the blood circulation at your knee, at your lower back. So we have a saying that like when you press the 尾中, the lower back can get more relief. So, and the other one is the 风池. 风池 is located at the base of the skull, and you can when you press your that position, the neck, the very upper point of your neck level with the earlobe, and it is good to relieve the neck stiffness. Yeah, and also how relieve some head issue like migraines, dizziness, vertigo, and yeah, this is a very good point to relieve the neck when you neck stiffness. And also 百会is at the crown of the neck, in the middle of your head. There, this is where 百会 located. Okay, yeah, it can help strengthen your brain memory. Yeah, and also it's good for treating headache. Yeah, and vertigo, and then like relieves dizziness. Yeah, so and some more like to relieve your neck pain, shoulder pain, neck and shoulder pain. When you first of all you can find 大椎. 大椎 is located at the C7. Yeah, cervical and when you flexing your neck forward, it is the most prominent part of your neck. So when you press 大椎, this acupoint, you can relieve your you have pain relief, relieve your shoulder tension and the upper back pain. Okay, when you located 大椎, you can connect this to the shoulder. Okay, in the middle of it there is a point called 肩颈. 肩颈, yeah, it's good for relieving stiffness, pain, or frozen shoulder. Okay, and also if it is effective for tension headache caused by neck tightness. Okay, this is 肩颈, but it's when you are pregnant, you don't press this point because it help induce labor. So it's and when you are pregnant, don't try with that. Yeah. Okay, 中脘. 中脘 is a it is a point that fortune above your belly button. It is good for stomach pain and also abdomen bloating or diarrhea. And loss of appetite is good for that. 天枢 is located at 2寸 lateral to your belly button. When you massage your belly, abdomen, and move it in clockwise position, it will help relieve the constipation. When you move anti-clockwise, you will stop the diarrhea. So that you have to remember it, like clockwise for constipation, anti-clockwise for diarrhea, and also relieve the abdominal pain like that. So this is the end of my presentation. I hope every one of you can get to know more about your different pain or get some handy technique to relieve the pain symptom. Okay, thank you.
Okay, thanks Monica Tang for your sharing. And also we finished today's online lectures. Thanks again for coming to the lecture. May you have a wonderful evening, and we'll see you tomorrow. Bye bye.